because I believe I have blessings. So thank you so much. So before I speak, I just wanted to send my sincere greetings from our regional director. Amecea works in the eastern countries, but of course, East Africa Regional Office from the Catholic Relief Services, we coordinate in 8 countries out of those, except Malawi and Zambia. But the rest of the countries that falls within Amecea are the countries also the regional office is also supporting. So Matt Davis sends a lot of greetings. He was to be here today. Unfortunately, he is in Tanzania. So he sends his sincere greetings. But also sincere greetings also from our new country representative, Darren Posi. Unfortunately, he is just 2 weeks old, so trying to settle down. And I believe he'll meet most of you in the next few days. For those who knew Rebecca Hallam, she left in June, and now we have a new leader. So I believe he'll be visiting KCCB as well in the next few days. I know at times people confuses Catholic Relief Services and Catholic Church. I think people should not confuse the two. We are one, and it's the church globally. So Catholic Relief Services started its operation in Kenya in 1965. Catholic Relief Services is an agency formed by the Catholic Bishops Conference of the United States. And whenever we implement programs with the invitation of the Catholic Church in that particular country. So whenever you see us in Kenya, we have all the blessings from the KCCB. And in any country where you see CRS implementing, we are invited by the Catholic Church of that particular country. So at any point, feel free to meet them, feel free to talk to them, because they are your brothers and sisters in serving the Lord. We have been working with KCCB since our arrival, and we are very humbled and grateful to have KCCB as our key partner here in Kenya. Is a key partner because anything that we do always has to come through KCCB. But also we are very grateful that we have been also working with AOCK, the Sisterhood of Kenya. Thank you so much. We implement several programs, especially the early childhood development programs, and we have been had a very good relationship for many, many years. And of late, we are also appreciative of Amecea region, where we have, at least in the past 2 years, started working with them, especially on the care reform. I believe this is just the beginning of a good work that will come in so many years. So we are very appreciative, and we believe we'll achieve more together. Care reform falls within our country strategy mandate. So Catholic Relief Services, especially here in Kenya, we are currently implementing a strategy that is from 2023 to 2030. And care reform falls within one of the priority areas, that is health, nutrition, and social services. And why care reform? It's because we believe by collaborating with the partners that I have mentioned, we are raising the awareness and building the commitment of family-based care to promote safe, nurturing family care for children. So this falls one of the key mandate of what we do. Actually, care reform or changing the way we care is one of the key, probably I would say, 3 or 4 major programs that Catholic Relief Services implements here in Kenya. And this program is not only being implemented in Kenya, it's also being implemented in other countries globally. My colleague, Edith, will highlight that at the time when she does a brief overview of what the changing the way we care is. So I will not speak much of the changing the way we care, because I believe Edith will do that on our behalf. But I wanted to also appreciate, apart from the church that we are collaborating with very well, I wanted to appreciate our partnership with the government. I know the PS will be here, but I know we have a big team from the government, and that's a testimony of the good collaboration and hard work we're doing together. We're very appreciative, and we thank you so much for the support that you have always provided whenever we have been looking any support from your end. Through this program, we have really worked well with, apart from the national government, but also with county governments as well. I think the county government has played a very great role in supporting the care reform. Of late, we have developed and passed disability acts in Nyamira, Siaya, and Kilifi through the 3 counties, and that is the testimony of their commitment to the care reform program. One demonstration county especially, that has done extremely well good work, and that is Nyamira. So the county has been actively engaged in initiative aiming at uplifting the welfare of families and children, ensuring their dignity and enabling them to thrive. The county government of Nyamira has enacted several policies. One, the Child Policy 2023, Nyamira Persons with Disability Act 2023 as well, but they also have been the champion of really helping or supporting other counties to learn from what they are doing. And recently they had organized a peer-to-peer learning exchange where it brought almost 80 participants from different counties in the country. So we appreciate, we want, or we believe through Amecea and other partners of other faith, we will be able to achieve the main goal of what we are all called for, to support children thrive and live in a very good environment, but while working or while living with their families. And this is the biggest call for every one of us. We understand there are challenges when we go or we want to achieve this goal, but I believe together with all of our hands, with the government and with the church support, we'll be able to achieve this goal. Today, tomorrow, and the day after tomorrow, we'll be learning a lot on how KCCB through the Archdiocese of Mombasa and Kisumu have been doing. And it's my request that once we learn, please let's take those learnings to wherever we're coming from, whether it's Tanzania or Malawi or Ethiopia or within Kenya in our other dioceses. Thank you so much. Again, as Catholic Relief Services, we appreciate and we humbly appreciate for the support that we have been receiving, both from the government and of course from the church in Kenya. Thank you so much.
Thank you very much, Robert. I know it was a presentation, but it's worth applauding in a special way. Can we clap again? Now we were honored and are honored to listen to a presentation from the National Council for Persons with Disability, Directorate for Social Development, Directorate of Children's Services, and National Council for Children's Services. We have the representative from the Council for Children's Services who could speak and brief us on behalf of them. Okay, they're yet to come. Oh, yeah, here. Yes. So, most welcome.
Thank you.
Are you projecting?
Good morning. My name is Stanley Harry from the National Council for Children's Services, and I'm here on behalf of the CEO. So I'm just going to read my comments and I'll be done. On behalf of the CEO, the National Council for Children's Services, our distinguished guests, our clergy, representatives from various institutions, state and non-state organizations, all protocols observed, ladies and gentlemen, good morning. I am honored to join you today as we gather here to reflect on the care reform agenda in Kenya and inspire our faith to action in regard to care reform journey. The National Council for Children's Services is a state corporation under the Ministry of Labor and Social Protection, State Department for Social Protection, and Senior Citizens Affairs. NCCS is established under Section 41 of the Children's Act 2022 to do the following things. Number one, to regulate, to coordinate, oversight children's services, and to advise the government on all matters relating to children in Kenya. The Council's vision is to secure and guarantee a protected and empowered children through the regulating, coordinating, overseeing, and advising the government on all matters of children. Since its inception, the Council has made significant strides towards achieving its vision of protected and empowered child through the same mandated laws, that is legislation, regulations, and policies, and guidelines, and of course the state party obligations. The government of Kenya, with the support from partners, began the process of developing a 10-year national care strategy with the goal of transforming the system of care for children in need of care and protection from institutional care to family and community-based care due to the negative impact of institutionalization of children. The strategy was finalized in the year 2022, and this was done in consultations with the multiple stakeholders. The overall expected result of the strategy is by the year 2032, most children and young people in Kenya will live safely, happily, and sustainably in the family and community-based care. The strategy has three main pillars. One, prevention of separations and family strengthening. Number two, alternative care. And number three, tracing, reintegration, and transitioning to family and community-based care. And this care strategy will be implemented in three phases. Phase one, the first 3 years, we call it preparation and demonstration. Phase two, 3 to 10 years, scaling up of implementation. And the last phase, phase three, 9 to 10 years, which it talks about review of the plan, and then culminating, if all things goes well, on July 26, 2032, when all institutional care in Kenya shall legally cease to operate according to Children's Act 2023, and of course waiting for the regulations to be gazetted. The National Care Reform Strategy for Kenya, for children in Kenya, comes against the backdrop of and in response to global, local, and regional conventions, including the United Nations Convention on the Rights of the Children, the United Convention on the Rights of Persons with Disabilities, the United Nations Guidelines for Alternative Care for Children, that is 2019, UNGA Resolutions of the Rights of the Child, and the African Charter on the Rights and the Welfare of Children. All these conventions reaffirm the significance and the leading role of the family in the care, nurturing, growth, and the development of children. Similarly, the Constitution of Kenya recognizes the family as a fundamental unit of society and the necessary basis for social order and bestows the responsibility of children care on the children's biological parents. It is this, therefore, the strategy is anchored in the law that children should, as much as possible, live with and be cared for by their family of birth. An estimated 4.5 million children around the world continue to live in orphanages and other harmful institutions due to poverty, disabilities, discrimination, and insufficient access to basic services, among other factors. Once separated from their families and communities, children in institutions are deprived of the love, attention, and opportunities they need to develop and flourish. The situation in Kenya fits this scenario. Kenya has an estimation population of 49.6 million, of which 24.3 million are children. A significant number of these children are at risk of family separations or live without parental care. Reasons for these such separations including poverty, disability again, orphanhood, displacement, harmful cultural practices, family breakdown, abandonment, natural disasters, ethnic and political conflict, and poor care arrangements. The data shows when we have some not very good scenarios. 3.2 million children living in kinship, 45,000 children living in CCIs, that is charitable children's institutions, 1,500 children living in 30 government statutory institutions, 15,000 children, 752 children connected with the streets, 200,066, 524 refugee and asylum-seeking children, 15% of children population have disabilities, 4,000 children are in foster care, and 8,000 children in adoption care every year. And these numbers call for attention for all those people who care. The study shows that there is overwhelming evidence that children under institutional care suffer severe and sometimes irreparable developmental setbacks as opposed to their counterparts in family and community-based care. The research shows that 8 out of 10 of these children in the institutional care have biological or extended families, and with appropriate little support, support to their families, the families could look after these children. It tells you that 8 out of 10 children who are in the institutions, only 2 of them should be there. The rest should be somewhere within the community-based care, only when the families are supported with some little help. To fully align with the globally accepted standard of care, the government, in collaboration with the like-minded players in the children's sector, adopted a unified, holistic approach towards reforming child care system by developing the National Care Reform Strategy for Children in Kenya. On this basis, the government has taken deliberate steps to transform child care system in the country. Over the last decades, various policies, guidelines, regulations, and other documents were developed, culminating in the development of the Care Reform Strategy and the Children Act, CAP 141, 2022. The Care Reform Agenda, gained further momentum at the country levels through piloting of care reform in counties like Kisumu, followed by Nyamira, Kilifi, Murang'a counties, and others followed. The strategy was finalized 2022 in consultation of these multiples, with the hope that by 2032, all children will be able to live safely, happily, and sustainably once again in the community, home and community-based care. The strategy sets out areas of focus for various agencies and stakeholders in the sector for the next 10 years and calls for collaborative effort and active coordination to achieve collective impact approach to this reform. Care reform is a priority and obligation that is shared by both state and non-state actors in the children's sector. And I urge all of us to embrace this agenda and play our part and implement the strategy. Although care reform is a government agenda, it's a government-led initiative, partners, stakeholders, and especially religious institutions in Kenya are called to make their contribution towards ensuring children thrive in families and community-based care. Together, we will need to mainstream child protection, alternative care, and family care and community-based care into national social protection systems and programs to ensure holistic and integrated approach and continuity and sustainability. The ministry is calling upon all to forge together in complementing the government efforts to transform the children care system from institutional-based care to family-based care. Acknowledgement. The success story of care reform in Kenya would not be complete without mentioning our partners for the technical and financial support generously given. The government is to acknowledge and appreciate with gratitude the great role played by partners and religious institutions for the child care in Kenya. The religious institutions hold quite a major number of CCIs, and Catholic Church especially holding 146 CCIs, both registered and unregistered. And that I can speak with authority because the registering officer is the one now speaking. I know which one are registered, and you have only registered 40-something, 46. I'll check. 146 CCIs within Catholic. Majority of them are not registered. Munione baada ya kado hapo hapo. Anyway, beyond that, the supportive engagement between East and South African Catholic Changing the Baby Care through KCCB and through the Changing the Baby Care in the last 2 years made a tremendous impact in the journey of care reform. We cannot thank you enough. Activities such as awareness creation of the National Care Reform Strategy and related policies documents across 4 ecclesiastical provinces was well noticed. Facilitating training to Catholic Church workforce, that is case management, alternative family case bearers, transition of care reform, CPIMS, safeguarding, etc. Jointly conducting supportive supervision exercises for accompaniment and of joint training after the training. Ongoing support and follow-ups during the integration at archdiocese residential care facilities levels is highly recommended. Over the years, Changing the Baby Care supported care reform process through piloting and demonstrating of care reform work in counties such as Kisumu, Nyamira, Kilifi, Siaya, and Mombasa, conducting situational analysis to get baseline of residential care, institutional care for children being placed under institutionalization, supporting the government together with other partners to have the national care reform strategy is partly due to the support by the Changing the Baby Care. Supporting the government to develop key guidelines again and tools to promote integration and transition of care reform, e.g. case management of litigation, SOPs, and the toolkits, alternative care family guidelines, transition of care guidelines and tools, supportive, I can mention so many things. So I think you deserve a big part from the government. And this is the work we are talking about, the much-work collaboration between the church and the government. Finally, capacity building of social services workforce, government officers, CCI staff, COS staff, community-based levels, and other important, which cannot all be mentioned, the support of the technical and financial supports we have been able to get from general. We just call it CRIS. The government didn't know there's those things. I know there's KCB, there is AOSK, there's all this one, but we always just name it CRIS. It is quite a lot. From the government, it is a big thank you. From and from NCCS, again, on behalf of the CEO, it is a big thank you. Thank you so much.
Thank you very much, Mr. Stanley. I think the clap was not loud enough. Can we do it again? Thank you. You know, our relationship with government, especially government of Kenya on this program, makes this program very unique. It is unique because slowly the government recognizes the importance of the family as a fundamental unit in society. and we know the church, we respect the family quite a lot. So we're journeying together that as we are talking about family, we are also having the proper understanding of family as it should be. So that connection is unique because both of us will share proper values of a family. And Kenya again has managed to move a step further to put into the constitution issues of reform, reforms on care reform. So this again has given policies and strategies on how different partners in this arena ought to operate. So thank you very much, government, and for the effort that you have done. You have really laid a proper ground for the rest of the players in this field. Now, may I invite a Quaker representative. A Quaker is a sister body to Amecea. What I mentioned about Amecea applies to a Quaker. So, Sister Clara, please tell us who you are. Thank you.
Good morning to you. He has already said that I'm Sister Clara, and that is my name. I'm Sister Clara Mangwengwe, a missionary sister of the Precious Blood, or simply Precious Blood Sisters. I am from Zimbabwe, I think one of the Z countries, the last country on the list. But I'm here in Kenya, I'm working in Kenya. I ride on the protocols that have already been observed. I'm here to deliver the greetings from our Secretary General, Sister Brigitta, who couldn't be here. I am not the Secretary General of our Quaker, but I'm standing in for her. And she sends here greetings. I also stand here to appreciate the fact that you have made us part of this conference, this important discussion, where we also need to learn from those who have done a lot in these care reforms. The Association of Consecrated Women in Eastern and Central Africa, popularly known as AQUECA, is a regional body of women religious from 10 English-speaking countries. We can safely say that AQUECA follows the Amecea regional countries, save for Zimbabwe, because it's in the southern region. The vision and mission of AQUECA are anchored in empowering consecrated women for deeper evangelization through different programs, which focus mainly on strengthening the capacity of congregation leadership teams, initial and ongoing religious formation, increasing the involvement of women religious in issues of early childhood development, sustainability of sisters' ministries through training our traditional social ministries into social enterprises with entrepreneurial skills, and also increasing the contribution and participation of sisters in the care of the environment through justice and peace and integrity of creation. The collaboration which has existed between Amecea and AQUECA dates back to 1973, when 4 sisters from 4 national associations were invited by the bishops at the Amecea Assembly of that year, simply as observers. So you can see that our collaboration, as earlier mentioned, is not just beginning today. It has been around for a while. A year later, in 1974, the foundation of AQUECA began to take shape. So this year, actually, AQUECA turned 50 years. So we are in the celebration mode of our Golden Jubilee. But then over the years, AQUECA began to change the name. At the beginning, it was called Amecea Sisters. So we're really inclining ourselves to Amecea body. But with more programs, the name began to change. That in 2002, that's when the current name Akweka came to be. There are indeed a number of programs that Akweka and Amecea are carrying out together just to push the mission of the church within the two regions. We really hope that we continue this collaboration because there's more to be gained when we are together than otherwise. We are really grateful to the organizers of this conference on care reforms, which Akweka has been invited to be part of. It is coming at the appropriate time. There is indeed need to change the way we care for the children. It is time that we, as women religious, begin to embrace the new ways of taking care of children. I think it is common knowledge that our ministries are populated within this. We run a lot of homes or other homes where children are either taken care of or the elderly. So it is appropriate that we also adopt new ways of taking care of the children. Akweka is coming to this conference with an open mind to learn from those who have made strides in care reforms and network with others on this worthy cause. We will also take an active role in rolling out this program, this agenda, in the rest of our region. As women religious, we are indeed involved in many social ministries, which does not exclude the caring of the children and the vulnerable as part of our apostolates. It is our hope that this conference will help us as sisters to adopt these new ways or these new reforms. With these many remarks, once again, let me thank you for this kind invitation. And as Akweka, we support this initiative, and we hope that the notes who will draw from here will be able to roll them out in the rest of our regional countries. I thank you.
Thank you, Sister Clara. Representing the Secretary General for Akweka. They are really our sisters. Previously, they were Amecea sisters. That was good. It was simple. People just know Amecea, and then thank you for being present. Now, we would want to have remarks from the Pontifical Commission for the Protection of Minors. You know, Amecea as a church, we have the connection all the way from the grassroots up to the Vatican. So the Holy Father sees what we are doing. Now we have the representative of the Holy Father here who works in his office. So let us hear what she has for us. Thank you.
Thank you, Father Emmanuel. Your Excellencies, Reverend Fathers, Reverend Sisters, and all protocols observed. Good morning. Good morning. You are well? Yes. We are very happy to be here. As you are told by Father Emmanuel, we are two of us. I, Augusta Muthigani, and Patience Mwangi, seated at the back. We are very, very grateful to Amecea for extending this invitation to us to come and listen and learn. We are here to listen and learn. The Pontifical Commission for Protection of Minors has a very strong team in Africa. We are 5 of us. We have our moderator, Sister Teresa, Anna Teresa from Zimbabwe, who I believe is known to a number of you. We have also Professor Benham from Ethiopia. He also works in South Africa. We have Emily, who works with the Bishops' Conference of Mauritius. And there's Patience and I, and we are very, very grateful to be here today. The commission was started in the year 2014, and the commission focuses on working with the local church. We collaborate with the local church. We have been collaborating with Amecea and the other conferences in Africa with the aim of ensuring that the Holy Father's mission of preventing, protecting, and responding to all forms of abuse that affect children and vulnerable adults are addressed. Ours is to support Episcopal conferences so that they are able to put up structures, policies, and guidelines that makes the church and the families a safer place for all of us, and mostly for children. We support conferences in reviewing their guidelines and policies by providing the universal guidelines framework, which we are currently going to pilot in Zimbabwe, so that we are able to give what is not only relevant, but fully African guidelines that will address our culture that is very strong when it comes to, has strong values when it comes to supporting children, preventing abuse, and enhancing family values. We also build the capacity of the local church, and we are very, very grateful because Amecea has given the commission an opportunity to build the capacity of church leaders. We did that with the bishops from Amecea in July. We are going to continue with that, with the safeguarding coordinators, also through the superiors, the Conference of Superiors, Major Superiors, build their capacity so that as they carry out their work at the grassroots level, matters of prevention, safeguarding, responding to cases of abuse are effectively addressed. We also enhance the pastoral ministry of the local church and promote the human dignity through safeguarding. We are collaborating not only with Amecea, but also with Ibiza and SECAM, so that whatever mission the Holy Father has in safeguarding will be implemented across Africa. One of our major activities is establishing the Memorare Initiative, which actually encompasses the care reforms across Africa. And we are very, very grateful to the Archdiocese of Mombasa, to Ethiopia and Malawi that are in the process of establishing the Memorare. The Memorare focuses on capacity building of every person in the church, starting with the leadership, the clergy and the religious, the rite working in the church, and especially working in the institutions that come into contact with children every day. Our aim is to ensure that we have evidence-based programs, evidence-based structures that will support each and every person in ensuring that the church is safe. And this is why we are very, very grateful to KCCB for initiating and piloting the care reforms, because we do believe that the strategies, what you have learned, the lessons learned, the strategies that you have put in place will not only benefit Kenya and will not only benefit the countries in Amecea, but other countries across Africa. And it is very, very important for us to have strategies that are homegrown, that are African, that are homegrown and that we can call our own, that will strengthen not only the family setup, but also the pastoral work of the church in this region. We look forward to further collaboration, not only with the Amecea countries that are represented here, but also the others like Eritrea, and beyond Amecea, so that whatever work we do as a commission is in line with what you are doing on the ground. Ours is to build on what you have, really build and strengthen it so that the mission of the church is accomplished. What we emphasize on is that every child matters, and that is what we all know. Every child matters. And the care reforms are fundamentally about safeguarding. Every child has a right to be respected, nurtured and cared for, and protected, right from the family setup. The children who are in institutions mostly are there because of child protection issues. And as we work through care reforms to transit them back to families, to foster families or their original families, it's very important for us to ensure that the child protection issues are well taken care of, because mostly that is what made them leave their homes to go to the institutions. And therefore, the church is doing what it has always been doing well, taking care of children. That is what the church has been doing all along through her institutions, and talking and advocating for children. And that's what we will support you to continue doing, to advocate for the rights of children, for their well-being. Because the children are our yesterday, they are our today, and they are our tomorrow. They are our church of the future. And therefore, ours is to encourage you, support you where we can, work with you so that the care reforms will bear fruits, not only in this region, but across Africa. And in the process, make the church and our communities and families a safer place for all of us. Thank you very much. God bless you.
Thank you, Augusta. I think she deserves another hand of applause. Wanted the Holy Father to hear that we appreciate her presence. Thank you. We are privileged that the government support is quite great, and we have the Principal Secretary of State Department coming in, which is really a great support, Thank you. So, feel most honored, Mr. Joseph Motari, the Principal Secretary, State Department for Social Protection and Senior Citizens Affairs. We are really happy to have you amongst us. You have just come at the very right moment, the moment for you to address us. We have already done the introductions, and you may just be privileged to know at least our bishops in front here. We have the Most Reverend Anthony Muheria, who is the Vice Chairman of Amecea, Vice Chairman of Kenya Conference of Catholic Bishops, and also the Archbishop of the Catholic Diocese, Archdiocese of Nyeri, the middle there. We're also privileged to have Right Reverend Joseph Mongela, Chairman of KCCB Commission for Pastoral and Lay Apostolate, and Bishop of the Catholic Diocese of Kitui. We are privileged also to have Right Reverend Edwin Mulandu, Bishop of the Catholic Diocese of Umpika in Zambia. We also have Right Reverend Severin Matthew, Bishop of the Catholic Diocese of Rurenge, Ngara, Tanzania. And the one who just spoke here, the one who just left, is Miss Augusta Mutigani, the Pontifical Commission of the Protection of Minors. She stands in for or rather an expert for Africa in the protection of minors, an office that is anchored by the Holy Father, Pope Francis. And the members that you have here are coming from the Amecea member countries that comprises of 9 countries in the Amecea region. We have Ethiopia, Eritrea, Uganda, Tanzania, Kenya, Sudan, South Sudan, Malawi, and Zambia. But for the sake of Akweka, we also have Zimbabwe. The one who just spoke here is coming from Zimbabwe. So we have that international setup and representation, and as you are addressing us, you are talking to all this representation. May I have the honor to invite you address the congregation.
Thank you so much. The bishop, the right honorable bishops, how do I call it? The right reverend bishops. Yes, I was going the other way around. And it is simply because I came too fast and only to sit and to be told to talk before I get the mood of the house. All the dignitaries from the various countries that have been mentioned, Zimbabwe, head of Zimbabwe, head of Zambia, head of Tanzania, Uganda, and all the rest. Ladies and gentlemen, God is good, and all the time, and that is His nature. Wow, thank you so much. Bishops, I belong to the Catholic Church. And normally I'm at the receiving end when I'm in church, and when we receive a bishop in church, that is a great day for us. That is when we have our family days. Yeah, then we receive the bishops as our guests. Now this time round, I'm here talking before the bishops. I don't know how to start it. But the chair, Anthony Muheria, is somebody I know very well. He's somebody who we know what he does in this nation. And even our guests from Tanzania, now that you are my relatives in East Africa, feel at home. For those who have come from far, on behalf of our government of Kenya, allow me to take this chance to welcome you into the country, not only for this particular meeting, but within our cities of the Republic of Kenya. Please feel welcome, feel at home. I know Chair Bishop Muheria will really tell you that Kenya is quite a hospitable country. We are the way you see us, and we like visitors. So feel at home. I enjoy your time. Don't be in a hurry to go back after this meeting. I am told it will be here for a week. Please, can we ask you to stay another week for you to feel the hospitality of the Kenyans in this country? So without much ado, my name, of course, is Joseph Motari. As I told you, I love being a Catholic, and I belong there. I'm the Principal Secretary for Social Protection and Senior Citizen Affairs. I was told to come here by my officers. I didn't know I was coming to get such a huge number of dignitaries from various countries in Africa. So I'll try as much as possible to say what I'm supposed to say, and then I will let others talk the rest that I'll not have said. We are here, of course, because of the care reforms. That is what I've been briefed by my staff. As you all know, children have been at the receiving end. You know, our children have always been at the receiving end. Our children have been harassed. Our children have been molested. Our children have been killed simply because of not knowing their rights. And even if they know them, they are weak and they are not able to do what or defend themselves. So let me straight away do what I'm supposed to do here today. Very short, brief. But mine will really to ask you, welcome to this country, as I said earlier, and we work together towards the care reforms of the children in Africa, not only Kenya, the children in Africa, because that is why we are gathered here today. The Most Reverend Anthony Muheria, Catholic Diocese of Nyeri and Vice Chairman of Amecea. Robert Mgeni, Head of Program, CRS, of course, Catholic Relief Services. Association of Consecrated Women in East Africa. Pontifical Commission for the Protection of Minors. All bishops present, distinguished guests, ladies and gentlemen, good morning. I am honored to be part of this gathering today, which addresses the critical issues affecting children in our country. The National Care Reform for Children in Kenya is a critical response to international commitments, such as the UN Convention on the Rights of the Child and the African Charter on the Rights and Welfare of Children. Our Constitution recognizes the family as the cornerstone of society, emphasizing that children thrive best when raised in families and communities. In this context, the Church plays a pivotal role, acting as a mother figure, especially for the most vulnerable. Father bishops, Reverend bishops, when we are in church with this, with our level, the padres, I sometimes take some time to go to these vulnerable institutions, especially for the older people. And in this case, I know my church at the shrine, we have the old padres, wale wazee wamezeeka, the padres that have retired. And those padres, you go there, some of them are really vulnerable. Because I really take time also to sit with them, get to listen to them, and know when you're old, you're vulnerable. All of us are agents of vulnerability. So, and I know what the bishops have done to us. I know what the church have done to us, especially on matters of children, on their education, on their care reforms, and all that pertains to the children. We really thank you, the Catholic Church, what you are doing and how you are collaborating with the government. However, we cannot ignore the reality of dysfunctional families in Kenya. Many faith-based organizations operate children charitable institutions, what we call CCIs, to support those in the need. Unfortunately, factors like poverty, disability, and displacement significantly drive institutionalization. The government of Kenya is dedicated to transforming the child care system through various initiatives, including the Inua Jamii Cash Transfer Programs, the Positive Parenting Training Program, the Family Promotion and Protection Policy 2023, nutrition, bursary, and other child protection programs. These efforts aim to prevent unnecessary family separations and promote family care. Ladies and gentlemen, and our bishops, you'll always believe and agree with me that a child brought up within a family care is better placed, is better loved by those parents than our institutions that we bring them upon. So please, what we as a government are embracing here is it possible for every child in this nation, in Africa, to be raised within a family setup rather than the institution? There are factors that may really force us into the institution. But if possible, we ask as a government of this republic that, if possible, let us raise children within a family setup. If the both parents are not there, then there should be close aunts or close uncles. Can we try as much as possible to bring our children within at least a family setup? There are many benefits that a child will get when he or she is within the family setup. I want to take a moment to appreciate the Catholic Relief Services for their invaluable contributions. You have been instrumental in several key areas, including one, engaging the Kenya Conference of Catholic Bishops in care reform implementation. Secondly, supporting government officers in developing key documents like the National Kafala Implementation Framework, SOPs for family strengthening and prevention of separation, and SOPs for supportive supervision for care reform implementation in Kenya. Thirdly, identifying and training foster parents will be placed within children. And lastly, you have also supported or assisted us in government officers in carrying out supervision in implementing counties. Distinguished guests, despite these efforts, we face significant challenges. One of the main issues is the shortage of families willing to foster children with disabilities. A child with a disability, ladies and gentlemen, and our bishops, is just a child like any other. That is a child that God has given you, and God had a reason to give you that child. It didn't come by bad luck, but it's a child which has been brought and needs care and needs to be loved like any other. Additionally, there is often a lack of awareness about the benefits of family-based care among communities. We must also address the gaps in training and resources for foster parents to ensure they are adequately supported. It is important, and we are keen on, as a government, and especially as a State Department in charge of these particular children, whether they are disabled, whether they are alive, whether they are normal, whether they are what. All children, according to us as a government, as the Department of Social Protection, we take them as children. So we should really support them and their parents who are not able to. And that is why our right bishops, we as a government, through our Excellency, the President of the Republic of Kenya, Dr. William Samoei Ruto, he's been very, very keen on what we call cash transfer. The cash transfer is money that we give, though little, but a stipend to push and at least put some meal on the table of that vulnerable child, of that vulnerable old person, of that vulnerable orphaned child or disabled child. So at least we give them monthly. As you know, our Excellency guided us to make sure that we do this by month, every month. Before it was bi-monthly, after 2 months, and it used to take a lot of time before this money is availed. In Kenya, for those of us who are not from this country, we have upscaled this one. When we came in the year 2022, bishops, we found the entire program at 1.2 million. We have now upscaled that to 1.7 million, and our target is to hit a target of 2.5 million beneficiaries for the cash transfer. And we are geared to make sure that we support our Kenyans, to pull these Kenyans who are at the bottom of the pyramid, to see whether we can bring them up. And with this one, we cannot do it alone. We ask our good friends of the CRS, we ask the church to also do their part as we do our part. We as a government cannot do this alone. We need support from all corners of other people to make sure that we upscale the cash transfer and also the lifestyle of our people. I request the Catholic Church to help in sensitizing other faith-based organizations that operate CCIs on care reforms to scale up foster care and kafala. Additionally, I urge you to enhance support for tracing and integrating separated children back into their families. As we move forward, I urge all faith-based organizations that operate CCIs to engage actively in supporting the government's care reform implementation agenda. Together, we can address these challenges, including the urgent need for more families willing to foster children. This collective effort is crucial to ensuring every child has a safe, loving, and sustainable home. In conclusion, the government of Kenya reaffirms its commitment to care reform strategies, striving to promote family care for children, not just in Kenya, but across Africa. Let us join hands in ensuring that every child receives the love and support they deserve. I thank you, and may God bless you. I wish you well. Thank you so much. Asanteni sana. I may not be back here again because the right bishops, reverend bishops, allow me to step out and do other things. I really wish I would get the advantage of learning what will be discussed here today, at least getting to know others who have come out of this country. We receive so many from our visitors from other nations of Africa to come and benchmark with us what we do. Yesterday, I had a group from Uganda to see how we operate on our cash transfers and social protection issues. And they are still in the country. They are here at least for 4 days. After we are done with Uganda, I've had Zimbabwe here. Where is Zimbabwe? May I see them, please? Oh, thank you. Zimbabwe are coming in the month of November, if I'm not wrong. They're also coming to benchmark with us how we are doing matters social protection. We are trying by the will of God we are really trying to see what is it that we can do to a vulnerable person. What is it that we can do to uplift that vulnerable person? So please, as a church, I really wish to thank you so much for what you're doing to take care of that vulnerable person within our vicinity. Should we get that child? Should we get that older person? Let us not kick a beggar. No, let us not shout at a beggar. That beggar is there, is trying to beg because he or she has no food. Let us talk to that beggar. Let us see what we can do and uplift that beggar from begging and graduate out of begging. I thank you and may God bless you.
So, a special hand of applause for the PS, please. Your Honor, we want to request you, I know you have other business to do, but we wanted to request you that you help to color our photo. Normally they say you are never there till the media people capture you. So wanted, after His Grace Anthony Muheria speaks to us, we have a group photo and we'll be privileged to have you amongst us. The photo won't take long. Thank you. Let me also have the honor now to invite in a special way Most Reverend Anthony Muheria, whom we know very well, of the Catholic Archdiocese of Nyeri, and Vice Chairman for Amecea, but also Vice Chairman for Kenya Conference of Catholic Bishops, to give us a keynote address. Your Grace.
My dear brother bishops here present, our PS for social services, Sir Joseph Mubari, our delegates from all over our Amecea countries and beyond, ladies and gentlemen. First, on behalf of the Bishop Chairman of Amecea, and also on behalf of Archbishop Chairman of the Kenya Conference of Catholic Bishops, allow me to also welcome you. We've already been welcomed by our PS to the country. I also welcome you on behalf of our Chair, Archbishop Maurice Muhatia Makumba, and also invite you to reflect deeply, not just listen, but reflect as we aboard this topic of inspiring faith action for care reform. A lot has already been said, so allow me just to make some brush strokes. What I intend to do is not so much make a reflection that is deep or conclusive, but just to provoke whatever discussions you're going to have, provoke our thought even in assessing what has happened already in the various pilot programs, and especially to map out what is realistically possible and reasonable within our culture, within our understanding of our faith, and finally within the timelines that perhaps are put to us by the legal authorities, the law that is within our country and also globally. So I would just touch on a few points. First, I would like to emphasize what is the base and pillar upon which we must always consider this reform. Children are a gift from God. At the center of all the Catholic Church's interventions in all the social issues, all the social actions that we are part of, is the principle of upholding the human dignity of the human person. This must always be the point of departure for any discussion to enhance, to redesign, to move forward. What moves us to intervene in all things that relate to the human living together, social fiber, social fabric, issues that arise from social ills, issues that we want to perhaps uplift, the first consideration we must always have: how am I enhancing, addressing the human dignity of the person who is a subject, and the human dignity of the persons who might not be direct subject but are in some collation or relation with this subject. So this is a point of departure for assessment of any design or program, to ensure that whatever action is proposed, that we proposed, enhances the human dignity of the person involved and safeguards it. So our aim is not efficiency, but dignity. And at times, dignity can be quite inefficient. And so we must be careful that we are not captured by just the good look, and yet the dignity is undermined. This, for example, are part of the things that we've had said about institutions that look very good, but inside the children's dignity is actually undermined. But it could be the other way too, that we may put this solution in a framework that seems excellent and good and efficient, but at the same time undercutting the dignity of the person. So the tremendous social ills that abound in society today that have led so many children to suffer this brand come from issues that are beyond the children and at times even beyond the family. The ills of poverty first, we've already referred to it now here, that affects the children who strive to survive. Poverty pushes children out to survive. And they seek many times unworthy avenues just to survive. So the survival mode is something we must understand within our society. And you will not understand survival mode until you spend a bit of time interacting in slums. And I hope that when we speak about these discussions, we also have practicals. I'm happy to hear the PS has time to visit the elderly. I still recall my first visit to the slum. I was in university, I was in second year, and we used to go every weekend to the slums of Mukuru, the one near Kariobangi, Sokomjinga, and that actually formed my understanding of what poverty really means. Because most of us think poverty is just our neighbor who doesn't have cows, until you see the minimum that they don't have. They don't have toilet, they don't have space, they don't have water, they don't have bed, and they don't have education. So I think it's important that we align ourselves also with the reality on the ground. Breaking down of the family unit. This is an issue that is not so easy to address. It has been said, dysfunctional families. Why are families dysfunctional? And what does dysfunctional mean? Because there are all kinds of dysfunctional families, and the effect that immediately they have on the children. If you put a child in a family that they are fighting, in a family that the father is a drunkard, what do you expose this child to? Or the family of a mother who is misbehaving, how does that happen? Or in a family that generally are a family of thieves. I don't think they are a family normally of thieves, but there are families who have. So it's important that we assess what we understand by dysfunction. Sometimes the dysfunction is very nicely laid out in the lines of social studies, anthropology, but I think we have to have a very clear, on the ground feel of what it means Domestic violence. We had this during the corona time, COVID. A spike in domestic violence. Domestic violence affects the children directly and affects them indirectly. And domestic violence is not only the sexual violence, it is physical violence, it's psychological violence, it is violence that also is from the society around. If your father is not a good man and your mother is not a good man, you suffer it without necessarily, by surrogate suffering, if you wish. It just spills over to the children. So these things are, I think, issues we should study when we are speaking about the dignity and the social ills that lead the children to be outside. So the question we should be asking, and I propose to you to reflect, are our streets safe? And that you say, okay, for street children, no. For normal children, for disability children, for special need, for autistic children, for children who are slow learners. Are our schools safe? Are our families safe? Why is the safety guaranteed? And so, in the think of those who are before us, they had a way of guaranteeing that safety. So how do we enhance? And safety of its own is not the good we seek, but safety which enhances their dignity. So this reflection, focusing on the places of safety without at the same time losing sight that that safety we know is a natural place of it is a family, but at times we have to calibrate and see when is it safe enough and enhancing enough of dignity in this environment or the other. So here I'm just throwing these ideas to ask, where is the dignity most imparted? Dignity is given, dignity is enhanced, dignity is nurtured, self-esteem. Where will it come out best? Where will it blossom? And sometimes it blossoms, I read the other day, that some fathers prefer to hold the child as he's riding a bicycle. And they run with the child and they don't let go. And so they put the bicycle with the extra 2 wheels so the child doesn't fall. So safety is so important for him, so the child never learns how to ride. But a father who knows that the child must learn will hold the child and then at a moment push. And there's a risk of safety. But the child then learns to ride. So where are we? Where is the balance between the two? And I think this is not an easy discussion. I think that's why we're here to discuss, to learn, and find the right balance. Because sometimes we can get a pendulum that goes on one side and sanctifies and sanctions one, like they did in the past. Now we go to the other side, sanction and sanctify, but we are not really considering what is the right balance. Second point, the primacy of children for us in church, in Jesus' ministry, that this is a central interest for us. And our interest should not be just merely negative. Many times we speak about children with disability, children who are extremely vulnerable, children. Let's also remember the positive, affirmative, and formative aspect of these children. That we are also saying, how can we enhance the dignity of every single child? We were just told shortly that every child matters and that we are caring for all. But how do we make sure that in our frameworks, we may use that, the child actually, any child will blossom? So what is it we must do, not only to protect the ones who might be in an environment that are perhaps threatening, but how do we create a bigger environment that will make any child blossom? And that's why in the third point we speak about what are we going to address in the family. So it is not only about the negative, because we all know that is in the foundational stages that we give, those early stages that we can give foundational ideas outlook. The child will learn the deep convictions, and that is where we can instill the noble values, increasing citizenry, godliness and goodness. Godliness and goodness both come together. So that is where we are speaking about faith, about charity, about care, about compassion, about mercy, about honesty, about service. All these are a mix we must sell. Now, since our children are our first subject, how do we make the environment that we are bringing? Because we are interested as church, not only in building very holy, pious people, but holy, noble, hardworking, and good citizens. Because the two don't go, they don't separate. Primacy of Jesus' ministry. We want to emphasize that Jesus did not only tell these people about the heavenly connection, the Father, he also gave them food. He also took care of them. He was interested in challenging their scope and their ways, their habits. So that too must be an entire mix together in whatever we give. That in the ministry we as church, we are convinced in carrying out Jesus' ministry that we must do both human and spiritual, and the two must work together. Again, this balance is important because what are we nurturing more in an institution and what are we nurturing in a family? Is this going to work? It is true. Orchids grow, the most valuable flower grows on rottenness, they say. Okay? It's actually growing on rottenness. So it's true. Even in very bad institutions or very bad families, you're going to get orchids. But at the same time, toxicity destroys whatever you try to grow. So you must have some kind of measure without condemning. The question is, are institutions of themselves evil? Are institutions of themselves totally to be excluded? Is that a goal that enhances us? Or are we thinking of emphasizing the key point, which is the family, as we are going to say now, but not as a goal specifically, but as how can we emphasize what is original so that it can enhance the dignity. So the third point is that the family, we understand, is the primary unit responsible for child care. So we must seek, therefore, here ways, discuss, how do we repair, improve, reinforce the environment of the family for the child to properly grow there. Our attention must be to assess families and assist families. In the assessment, there may be families that cannot work. Then what? I think that's something we have to face. So we try to assist so that the family be the adept place to help and nurture our children. So the question would be, are families prepared to receive the children? Is it just financial? Or is it, for example, an autistic child or a child with mental disability? Are the families prepared? What does it mean to prepare them? And will they care for them? I have a bad story. 2 children from one of our institutions, it is a mentally disabled institutions, were reintegrated in their families. It's a poor family, they're in poor families, they have let's just say they're poor families. The father is all over the place, the mother is trying to survive. She cannot stay with in these 2 families, both families. They cannot stay with their child, their daughter, who is mentally handicapped. So 1 year after reintegration, the child, she's with child. She's pregnant. And you don't know who. One of the guys in that homestead. Then you ask, was it the right thing we did? I had that problem. Did I do the right thing? Did we do the right thing? To let that child go there? Was there preparation? Was the mother able? Is there capacity? Now, sometimes you see we do things more led by idealistic. We should go down to practical. When we reinstate, and I think that's why I feel these care reforms are something of discussion and a bit deeper than just superficial, deciding it is A or B as if out. I think it is something that we have to really walk and deepen and make mistakes and return and come back and make second mistakes and then find finally a balance. So the main concern, how do you tutor and nurture families to make families worthy environments? How to make, first, marriage a stable setting. Currently in our country, it's very difficult to get married. I say it's very difficult. Right now, there was 2 days ago, we are doing that as pastors, but government makes it more and more difficult. You have to get the registrar. So people have stopped getting married. So the marriage becomes a very amorphous. So how can we emphasize the marriage institution? And also, we, the Kenyans, or even in Africa, have lightened the idea of going for a formal marriage, saying be in charge, or for that sake, in registration. People come, you stay is becoming kind of okay, they say nowadays. It's kind of okay, yeah, and then they finish it there. How can we work to make the institution of marriage more emphasized and easier and more protected? How can we give a better legal underpinning? How can we encourage families to give dedication to their family time? Because it's the same, quality family time. What can we do with families to help fatherhood, which is one thing and is becoming an extinct reality, fatherhood and parenting. How do we help? So when we speak about family, what are we going to do to make sure families become worthy receptors of this challenge we're going to give to them? Conflict resolutions in families. They are fighting. In our past, in our culture, there were ways. Now, how do we solve the conflicts between husband and wife or between two families? What are we going to do? You may say it is not within our scope, but it's within our scope because if we don't solve that, that's where the source of the problems comes. And secondly, it renders them incapacitated to receive and be worthy places to nurture those things we say we want to nurture in the children. How do we support the special needs? I have the example of autism. Many children of autism, of the poor people, they don't know what to do. They are tired. The child have worn them out. They are looking for someone to send that child so that they can take a 2-month break. And I can understand them. They just run to the ground. Why? They don't know how to handle them. It's too expensive to handle them. They can't go to a speech therapist. So how do we, it's not just about money, it's about structures to support those who have difficulty. We as church, commitment of the church, we commit to this. And I think this is what maybe we as bishops and we as church should think also, supported by our partners. How can we work towards strengthening the family? Because we must sharpen our surveillance on families to ensure the child is cared for. And how? Because we must be more preventive than remedial. Too much the institutions about remedial. The problem is the children are in the streets, let's put them in a space. But why did they go to the street? The mother was in this, but why can't we go fast to heal the source? Because this one you put in institution, you get another one coming out. So how do we change our perspectives from being just reactive in terms of remedial, to make it more preventive? How do we avoid separations of children from their families? And I think we have that, we as church, challenge. And I think it's something we can discuss because I don't know the answer. I'm just throwing it there. I'm throwing it to you for thought, discussion, and perhaps bring out some ideas that we can take up. By extension, we must care for other environments that are also children environments. Our schools. The focus on our schools has changed a lot from formative to just academic. The reason the Catholic Church was involved in education from the beginning was a formative aspect. That's why everyone says, oh, I went to a Catholic school, you know, they were so good. I would not be who I am if it wasn't from the school, because I was formed. Right now, with a population of 1,800 students in a school, with one headmaster, one principal, 2 deputies, and God knows, the formative aspect, they don't even know the names of the students. They don't know. So we are saying formative. That's why we are now going to the preventive, to the remedial situations. Oh, there is fire here. Oh, there is strikes here. So how do we stop strikes? We have put a lot of cameras in our schools. Every place has got CCTV. That's our way of reacting. We are not reacting about forming. We are reacting about policing. So we also in this discussion can end up being police, women and men, so that the child is not hurt, abused, rather than trying to form the child to be what God wanted them to be. So that's a discussion to have. Our books, the children, what books have been read in the primary school, in the secondary school, in their literature? What are they being taught from the early ages? And that is not irrelevant. It is very relevant, because in that's where they form their initial ideas. So if they believe that men are evil, God forbid, from when they are small, those kids will not ever love their father. If they believe that mummies are the only ones who know, those kids will remain at a baby level. So, I'm not giving examples that are not quite there. Digital. How do we, this environment of digital, how do we form them? Care. We know about all these cyber pests. Those who wait for the kids on the cyber. So what are we going to do about it so that this environment is better? TV, music, the two, music and idols and pop idols. How are we going to manage that? Because that is also an area that is influencing our children. And then finally, the collaboration between church and state and non-state actors. Church, state, non-state actors. We really must reflect how we must have this collaboration. And the main difficulty is to find the right platform that we can talk at the same level, common good, value of person. And I think here, having all those representatives, and I think CRS also working on that, if we are able to discuss and have that bottom line, and not just statistics, because unfortunately, state actors, that means government, love statistics to say what is happening. And NGOs get money because of statistics, so they love a lot of statistics. Let's get away from the statistics. Let's speak about the values, and many times they are not easily measurable. So if we can have the same level, we can work together. I think it is about having a common. So often care for children is seen in perspective of crime, legal, organizational, depersonalized views, where it's more about careful. We are going to make sure that anyone who does anything to a child is going to go for a 15-year jail. Good, but that doesn't do any good to the child. Can we have a platform where we are really caring? So I love the title, Care Reform. So it's not so much about the reform, how I wish we would also speak a lot about whether really the care is care. So let's expand that discussion, and whether we are speaking about the same point of departure in terms of care. So we therefore must not only think about the needs of the child, the clothing, the food, the shelter. So we must be a little more practical than idealistic. Let's not remain at good ideas, good plans, things they have worked out in UK, things they have. Let's just think about ourselves having this. What is most practical in our backyard? Nyeri. What can I do in Nyeri that works? That's my diocese, yeah? So care reforms, and I conclude, in my view, I humbly ask, and your reflection on this, I believe that care reforms must be fundamentally about attitude. How do we address attitudes in families, in people, in leaders, and those who are somehow involved with the children? How we can change mindset from mere material provision, from mere safety to dignity to nurturing, formative, blossoming. And third, to a true conversion of hearts, especially of our parents, families, and of leaders, that we must avoid making the disability or vulnerability of children a currency for politics. And I hope I'm forgiven when I say that. We must not make this statistical for political visibility. It must be something we truly change, and not just something we give as window dressing. For us, our church, we know is the right perspective. We have the right perspective, and we know that because it's a reflection about how we can make that child blossom into be the image and likeness of God. And our role is to restore dignity where it has been deprived, distorted, crushed, and also to nurture where it is yet to blossom within the scope of what they are able to. And that dignity is not a material value, not measured by material, but measured by something within and deeper. So carry this conversation to that level, and I think you might have very good suggestions for us, especially we, the church leadership, to then reflect and see what must we change in our direction and orientation so that that which we feel is a call that God gives us in this moment can be realized. Thank you very much. God bless you.
That's really a message to think about as we reflect over this issue on care reform this week. There are a number of fundamental questions for reflection. Let's really give them chance and come out with answers that will satisfy our leadership. So I wanted us to appreciate in a special way His grace for the presentation, and I wanted you to do it in a Malawian way. The way we respect elders. You know, you hold the hand like that, and you do slowly. Thank you. Now, allow me just for a minute to ask the two elders, His Grace and Joseph Mutari, MPS, the Principal Secretary, to come in front. We wanted also to give you a small appreciation that will make you remember that you are here. So just for a second, come in front. maybe you could stand there. So we have a token for His Grace to remember the contents that we have for this program. Thank you. And another token for the Principal Secretary. Thank you. A hand of applause once again. Thank you very much. Now, as our two elders are shaking hands, we request that we go for a group photo. As we said, you are never there till you appear on a photo. So maybe Father Jacob, can you just offer a prayer as we go out?
Let us pray. In the name of the Father, and of the Son, and of the Holy Spirit. God our Father, we thank you for the session that we have had. Thank you for our guests. Thank you for the delegates who are here. We thank you and we ask you to bless now what we have received. As we break for tea and for the photo session, may you bless the tea that we are going to take, that it may give us enough energy to continue having the care reform conversation for the better and best interest of the child. And we ask all this through Christ our Lord. Amen. In the name of the Father, and of the Son, and of the Holy Spirit.
Amen. So the media people, you direct us where we can have the photo, and let's do it quickly so that we go for tea and then come back for...
We will take the ground floor.
Okay.
We will take the photo from ground floor. Behind this hall, there's some nice place that is already set. You just take the stairs, go down, then you go to this side. We'll take the photo from there. Thank you.
The phone?
So it is something that is part and parcel of us. Even if you are not a child protection officer, but in one way or the other, you are affected by whatever is happening around the child. So when we started talking about care reforms, that was from the year 2017, I will say that it was during that particular time where a moratorium on the registration of new charitable children institutions came into being in this country. And therefore, it meant that there was no more registration of NCCI that was to take place. And that was the journey where the care reform process was actually beginning. I want to say that even before that, in 2014, we had a moratorium on inter-country adoption. That meant that Kenya had to actually restrict any further adoption of children by foreigners, especially those who had the intention of doing the same. I also would wish to inform us that by 2018, we had a number of trainings on care reforms that was taking place. And the pilot program on child care reform at that particular time, it was done in the county of Kisumu. It went on for a period of time where so many learning points arose, and thereafter we had an assessment on social reintegration and rehabilitation of children who are in conflict with the law. Around 2019, where these things of training, so the process of training the caregivers and also sensitizing the community on what was happening was going on alongside other practices in child protection. In 2020 and 2021, that is the time we were struck by COVID-19, and things were a bit had, because it was the first experience. We had never encountered such during our days. But we had other things coming into place, and we must appreciate the efforts that was demonstrated by them, especially with our key partners in child protection, and also the institutions, faith-based institutions that were having children by that time. I want to say that it was during that particular time that we were exposed to learning quite a number of things about having meetings virtually, and the issue, the essence of technology was very key at that particular time, and therefore it meant that each and every one of us was actually to learn some of the new things that we were not used to, and therefore it had to give way to help us manage the situation or child protection issues at that particular time. First and second levels of data collection on children released from institution was also conducted. During that period, you realize that the government made a deliberate decision to be able to remove children from the institutions back to the community. And it was not easy because no one was prepared to receive the children. But I want to appreciate the efforts by the stakeholders, especially the partners, who were able to fund the process and to ensure that all the children who are living in the institution by then were taken back to the community. We didn't manage to take all the children from the institutions, but we had a few cases, especially those children who are with disabilities. It reached a point whereby sometimes you could not be able to trace where these children were coming from, and therefore it became a bit difficult for them to be removed and placed to a place where they could not get safety and protection. So it was during that particular time that Kenya also made a deliberate effort to be able to visit some foreign countries, one of them being United Kingdom, and then Rwanda and USA. When a team from the directorate visited Rwanda, we learned that care reform in Rwanda has been a success. And that means that all children are out of the institutions and they are back to the community. It was a success, and learning from the same, we as a country say that it is possible even for us moving and trying to embrace whatever practices that they were doing, and in consolidation, of course, with the stakeholders and with the institutions that were hosting these children. There was development of case management for reintegration package. Then this was just to help us as caregivers and all the concerned in this process of care reform to be able to understand how are we going to move children from the institutions back to the community or back to the family of origin without necessarily bringing harm to them. Rapid situation analysis was also conducted in 5 counties, that was in Kisumu, Kilifi, Kiambu, Murang'a, and Nyamira, where a lot of things came out, and therefore it prompted to the training of Directorate of Children's Services officers and stakeholders on case management together alongside, so that they'll be able to understand how the process was going to be done, and also learning on alternative family options that are in place. Then thereafter, we had also a high level of ministerial training, especially on care reform. We had also the development of guidelines on gatekeeping mechanisms. So I talk about gatekeeping mechanisms. This is something that all of us, especially after listening from the Archbishop speech, you realize that this is where, as government and all the key stakeholders in child protection, as we embrace care reform, we need to put a lot of emphasis on gatekeeping practices. It is there that we shall be able to probably understand some of the things that are affecting our children and also be able to talk to the community, sensitize them, understand the kind of life that they have been leading and how best they can be able to embrace child protection without much struggle. You realize that care reform is not a small thing. In essence, it is an expensive process. And therefore, for us to be able to embrace it fully without much struggle, there is that essence of trying to sensitize the community to understand what is this that can be able to work better and what is this that cannot be able to work out. And therefore, as we do this, we shall be able to help ourselves be able to transform in the mind on how we are supposed to embrace this particular process. Scale up pilot programs to 4 other demonstrated counties was also done during that particular period. That was in the year 2021. Now, care reform strategy phase 1 has been embraced between the year 2022 to 2023. There were development of foster care facilitators guide for training practitioners and parents. Remember, because it was now being scaled up to other counties, coming from a few lessons that we had learned from Kisumu County, which was our county for demonstration or pilot, we were able now to roll out to 4 other counties. And there, it meant that now we had to develop a training manual that was able to guide the facilitators and all the practitioners together with the caregivers to be able to understand what is this new thing that the government was talking about, care reform. Scale up of care reform in Nairobi County was also put in place, which focus specifically on disability inclusion. As I continue with my presentation, may I also inform the participants who are here today that a major challenge that we've been encountering is how to transition children with disabilities back to the community or to the family of origin. It is a challenge, and it is not something that probably the community is ready to embrace. And maybe we shall be able to look at it as we continue with the conference. We've also developed, there was also development of county-specific care reform strategy and child protection policy. And this was realized in the county of Turkana and also the county of Nyamira, where one of the participants, one of the speakers, was also able to mention. We've been able to come up with the new Children's Act of 2022, which in essence is actually embracing care reforms and some other emerging issues that are happening within the nation. We've also carried out a sit-in in Meru and Kirinyaga counties, where we were able to just establish the state of children who are in the CCIs and how best we could be able to go about by ensuring that they are transitioning back to the community. A report on social reintegration and rehabilitation of children in conflict with the law was also put in place. And this, as you are aware, children in conflict with the law They are still children. They need guidance. But how do we help them, especially when they are going back to the community after being in an institution for some time? There are other challenges that may come about, but it is only a matter of trying to sensitize and also understanding the developmental aspect of these particular children and giving them proper guidance. A blueprint on social reintegration and rehabilitation report was also developed, there leading to supportive needs survey conducted for children with disability in institutions in 5 counties was done. There was also development of support package for children with disability that was that came into existence, and this was after working closely with one of the partners who was carrying out care reform and assisting children with disability. And therefore, when the government was working with this partner, it was able to see practically what was happening and also get some of the key points that were helping the partner to be able to successfully transition the children back to the community. It has taken shape. So far, care reforms in the country, it's taken shape. I may say that it is not completely failed in all the counties that are implementing, but there are some few portions or areas, especially where we have the institutions working that have been able to demonstrate that care reform is taking place, though it has a few challenges. It has taken shape in it is now over 15 counties, and if I have to mention them, we have Kisumu, Nyamira, Kilifi, Siaya, Mombasa, Embu, Kiambu, Murang'a, Kirinyaga, Nakuru, Kajiado, Turkana, Garissa, Nairobi, and Meru. Others are still embracing, like the one that is just coming on board is Machakos County. We have partners supporting this process. Just to mention but a few, we have UNICEF, changing the way we care through CRS, SOS, Tree of Life, Lumos, Legatam, Stahili, Hope and Homes, amongst others. Just to be able to share with us some of a few achievements that we've been able to realize. We have child care reforms, which is actually a flagship project in place. And this, we've been able to work closely together with the stakeholders and actors in this. Then we also have enhanced CPIMS module, that is alternative care, institution, and missing children modules. I want to say that Archbishop was talking about data, and it is true that data is useful for us and for any program to be able to find a place, especially in the country, which can easily be used by either partners or any person who has interest in the same. So for us with child protection, we have child protection information management system, and there we have a module which we call alternative care module, which helps us at a glance. You are able to just identify some of the children that have already been transitioned back to the community and those that are still in the process. So it is there in place. We also have institutional module, and we also have missing children module. Alternative care module has been rolled out in the following counties: Kajiado, Kiambu, Kisumu, Nairobi. That is for Nairobi County, we have Kasarani sub-county. It is not the entire Nairobi County. Then we also have Garissa, Turkana, Nyamira, and Siaya. 3, we have family strengthening and prevention of family separation services, where in this we have the Inua Jamii program. I must say that the initial criteria that was being used to recruit the beneficiaries into the program was somehow reviewed, so that some of the children that have already been transitioned to the community and back to the family of origin have also been brought in. So as we are talking right now, I know that there are a number of beneficiaries that have been through this program of care reform who are already benefiting from the Inua Jamii program. As one speaker alluded, the stipend that is given is not enough, and especially in these changing economic times, it's not enough. But what we are saying is there's nothing that will be enough. It's only on how you are going to utilize whatever little resource that you've been given. Then we have been able also to create awareness across the country on care reforms. You may also realize that there are some parts of this country that have never heard about care reform. So that becomes a big challenge even for the government. But we are in the process, and we are calling upon us people as faith-based organizations and institutions to be able to help us to create more awareness, especially in areas that majority of people do not understand. We have several successful NGO initiatives that have come up aimed at preventing separation or supporting reintegration being established. I want to say that for us to be able to prevent separation, we really need to put a lot of emphasis on sensitizing the community. Because it is true, actually this is, to me, I count it to be like the pivotal area of all care reform agenda. Simply because once the community has been empowered with the information, they shall be able to put some gatekeeping mechanisms in place, and they'll be able also to come up with the locally acceptable solutions that will be able to separate, to help these children from separating themselves from the family. As I wind up, just to continue briefly on the major achievements, you realize that actually care reform agenda is being spearheaded by Directorate of Children's Services together with partners. And some of the partners that I was able to mention, they have been able to help the government to be able to realize quite a number of things. Case management package for reintegration package, standard operating procedure for implementation of alternative family care is already in place. We've been able to have a user-friendly handbook for alternative family care. Then we also have the gatekeeping guidelines for children in Kenya. The National Care Reform Strategy and the Children's Act of 2022, it was through the initiative of partners. Then we also have the transformation of residential care. Approximately 10 institutions have been able to transition their children back to the community across the country successfully. Then we also have supporting caregivers and engaging them in care reform. The caregivers, these are people who have been, children who have been in the institutions, and now once they are done with that period of being in the institution, they have to find a way back to the family of origin or back to the community. And therefore, efforts have been put in place to ensure that even as they go back to the community, they are also supported so that they can be able to fit well in the community. Then we also have the Niche program. Niche program is a program that has been initiated by the government to be able to help those children, especially the age 0 to 3 years, that are likely to suffer from malnutrition. And therefore, the government is still scaling up the program, and so far, this year has been able to carry out the nutritional improvement through cash transfer, health, and education, top-up of 500 to registered Inua households in 5 counties, namely Marsabit, Turkana, Kilifi, Kitui, and West Pokot. So on top of the small stipend that they have been getting, through this niche program, they are able to get an extra money, about 500 shillings, just to support them. Then we also have the presidential bursary support, which has been ongoing for the last 12 years. And so far, the government is supporting 22,000 orphans and vulnerable children who are in high schools. We also have development of the guidelines. I'm sorry, I'm just sorry for this mess. I want to say that, as I conclude, I want to say that the care reform agenda has had a number of challenges. It is not easy, for example, at the moment, to get the exact number of children with disabilities who are in the institution. Reason being that we have the institutions that have already been registered, and we have also those institutions that have not been registered, and yet they host children. And as I mentioned earlier, children with disabilities, some of them are having a multiple kind of disabilities, and therefore it becomes a big challenge. Even when you sensitize the community, how they are going to embrace it, and especially accompanied with the workload, because some require 24/7 care and support. And it is also an expensive task that it may not be easy even for the caregiver who may have, or the potential caregiver who may have maybe the desire and the willingness to take up that particular child. I do not want to take more time. I just wanted to highlight that. I know we have more challenges, but some of them you already know. Therefore, I want to stop there, and thank you for listening.
Thank you, David, for that wonderful presentation. I wanted us to thank him in a special way. We clap 5, and then we go in a descending order up to 1. Can we do it in his honor? So 5, 1, 2, 3, 4, 5. 1, 2, 3, 4. 1, 2, 3. 1, 2, 1. Thank you. Now, if you get the programs that were given to you this morning, the next page looks a bit different. It takes us to day 2. It was just a mix-up when they were binding these pages. So you'll take the page opposite the day 2. That's the next forum. Yeah, that's, yes. The same page 2, day 2, but just the other side. Flip it on the other side. Now we have the presentation coming from demonstration to scaling care reform. From demonstration to scaling care reform. That's Catholic engagement in Eastern and Southern Africa region, and it will be presented by our dear one, Miss Edith Apio, Project Manager, East and South Africa Catholics Changing Care. Miss Edith. Thank you.
Good afternoon. God is good, and all the time. I want to present what Changing the Way We Care has been doing, and I want to request your 20 minutes at most. So I want to seek your attention so that we can be able to learn from what Changing the Way We Care has been doing, and I'll be building up from what has been presented by my brother, Changing the Way We Care has been one of the partners that started demonstrating care reform. You'll be able to see from the presentation. And then I'll be able to link it to how KCCB and Amecea are coming in. So it's not showing, George? And my presentation is on from demonstration to scaling care reform, Catholic engagement in the Eastern and Southern Africa region. I want it to come fast because it's good to present when people are seeing. You're able to capture their attention. Is there a hitch? Okay. So maybe I would start by saying that changing the way we care's fundamental belief is that all children deserve to live in a family and not in a residential care. So that's our belief, and we've been working for the last, since 2018, that's when Changing the Way We Care was launched. And we've been working with other partners, Maestro International, Faith in Action Initiative, Better Care Network, and the local and national governments. So we actually have a vast experience in care reform, and that's what has made us scale up care reform within the Catholic Church, based on that, experience and technical expertise. So my presentation outline is such that we are going to look at the overview of Changing the Way We Care, and here I'll take you through the mission, the goal, the objectives, the strategies, some of the key achievements. And then I'll also take you through the Kenyan presence, the global presence, and then we go to why the Catholic Church. So when we'll be looking at why the Catholic Church, we'll be looking at some strategic opportunities that made us get into the church. But remember, we are also part and parcel of the church. And then I'll also take you through the journey. What are some of the tools, the strategies, and what are the lessons that we are getting as we implement together with KCCB? Then lastly, the way forward. But this will be an opportunity for us to reflect what are the opportunities for the regional church going forward. So I'll start with our model. The Changing the Way We Care model is designed such that it's able to look at the 3 pillars in totality, looking at the governments, looking at the families and the children, and also looking at the global governments, you know. And you clearly see why those 3 pillars. When we talk about the families, we are very keen on family strengthening, what our Archbishop was talking about. What is it that we are able to do to assess the families and be able to support families, to be able to retain children so that they're not separated, or be able to accept children back for those who are separated. And then when we talk about governments, I think that clearly speaks to what my brother was presenting about legislations, guidelines, training manuals, and also the support that we get from government. And then family care at global level. Remember, most donors are at the global level. We also have global partners that are also, they come together and then be able to support the care reform agenda. But we are also saying that our goal is to have children thrive in safe and nurturing families, but supported by systems that promote family care. So that's basically our model that is in Changing the Way We Care. And this model was designed in such a way that it ensures demonstration. You realize for us, we talk about demonstration counties. Even as we talk about the 2 archdioceses, we talk about demonstration dioceses or archdioceses, you know. And then it also, the model also gives room for learning. It gives room for adaptive improvement. It gives room for scaling. And you'll realize Changing the Way We Care is a global initiative, and the global, the diversity of demonstration countries was deliberate to be able to inform that global model, you know. And family strengthening is key when we talk about care reform. because it's these family strengthening interventions that are able to build resilience within families, and empower them to be able to support children. So I'll move to the next. Changing the way we care is anchored on partnerships across, including the residential care facilities, including the academia, where we are able to learn, including the governments, very critical, UN and other global agencies. That's where you hear even we work with UNICEF. And then most critical is the faith-based organizations. And for us in Kenya, there are a number of partners that we work with, and some of them have been mentioned by my brother from the government, and some of them are here in the room, so that we are able to reflect together and be able to learn together. So changing the way we care is anchored in partnerships, and as you see, it's a multi-sectoral approach that you can't do in isolation. I'll continue. So our global presence, changing the way we care, currently is in Guatemala, Kenya, Moldova, Haiti, and India. But we are also starting to scale in Burkina Faso, Ethiopia, Malawi, and Uganda. But with that, it gives us a very good impetus to start influencing the East and South African region. And the Eastern Europe, the Latin America, you know. So there's that potential for scale. And that's why we are already slowly working with the church to influence the East and Africa region. So that's the global presence. I'll get down to Kenya. As I said earlier, changing the way we care was one of the partners that got into changing into care reform as it was starting. So most of the counties that you had my brother mention, they are counties where changing the way we care through CRS has been supporting to demonstrate that it's possible to have children be in families. I don't want to get into the details of what we have done, but those are some of the families that we impacted in the last 5 years. But now we are in the scaling phase, because we did demonstration up to 2022, and then we learned our lessons, and we started now scaling. We are actually now in the scaling phase. We are not doing directly to families. We are not doing family strengthening, but we are doing more of system strengthening, working with the government, improving the systems. Like what my brother was talking about, upgrading the child protection information management system, that's part of what we do. But we are also promoting local leadership, building capacities of partners to be able now to get into the care reform agenda. And that's why we have KCCB and Amecea as part of our scaling partners to be able to build their capacity, hold their hands, do a lot of technical support, accompaniment as they lead the way. So I will move on to some of the achievements. I don't want to repeat them, but we just identified some of the key achievements, but you'll realize it resonates to what my brother from the government was talking about. Because remember, care reform, you don't do it in isolation. You do in partnership, but we have a contribution. So some of the critical achievements that we are proud of is we have contributed on research and evidence building. The situational analysis that my brother was talking about, in all those counties that we have shown, we have done. And even with the Catholic Church, as we started, we did a situational analysis. So the package that you'll be receiving of the materials that will be launched, one of them will be that, just to see what is the situation within these institutions. Government-endorsed national documents, those are many policy documents, the Children's Act, the National Care Reform Strategy. We've been part and parcel of the team developing them. Participation of people with lived experience, we are very, very keen on that, because you cannot advocate for us without us. We understand our needs better than you do. So that's where we are very keen on meaningful participation of people with lived experience. And that's why we have our sisters and brothers here. We'll be able to hear from them tomorrow in a panel discussion. So we are also keen on disability inclusion. As we heard, that's one of the greatest drivers of children being in institutions. So we are also very keen on disability inclusion. How do we support caregivers or families to embrace children with disabilities and be able to thrive like any other child? So those are some of the, I don't want to get into all, you can be able to see by yourself, but one of our greatest and newest achievement is engagement with religious leaders. KCCB, AOSK, Muslim leaders, so that's part of our newest achievement as part of our scaling in care reform. We are also very keen on partnerships. I think that I said, and I don't want to repeat. But most importantly, as our head of programs was saying, we've also supported the county governments to develop child policies, disability acts, so that we are able to promote safe families. So, East and South Africa Catholics Changing Care. Based on those achievements and the 5 years of implementation from 2018, in 2022, we got a request from KCCB that they would want to be part and parcel of the care reform journey. And we got into looking for funds. UBS Optimus Foundation was able to give us a 2 years investment. And exactly that's why we are here, to be able to share some of the lessons and be able to say that, yes, it's possible to implement care reform within the faith spaces. So, and I want you to see the subtitle, Supporting Collaborative, Locally Led Systems Change and Models for Family Promotion at Scale. So there's so much potential within the Catholic Church to promote family care at scale. So I'll take you to the next, which shows why the Catholic Church. As I said, one of the aspects is that the Catholic Church is the greatest influencer of social norms and practices. And I think even from the Catholic social teachings, and even what our Archbishop was telling us, is clearly about the dignity of the child, the importance of family, So the Catholic Church is a big influencer of the social norms. And then the Catholic Church operates a wide range of social services. We are in education, we are in healthcare, and all that, in one way or the other, supports childcare. But also, most importantly, we are also promoting residential care. As part of those many services that are supporting children. But when you look at the both global and national policies, they are geared towards promoting family-based care. So the Catholic Church is a very good candidate for being a leader in care reform. The Catholic Church is engaged at every level, integral part of any change process. Why do I say this? When you look at the pastoral programs, the Catholic Church is a very strong promoter of family life. I don't want to say activities, interventions. So they are also promoting family strengthening, but they are also sponsors of residential care facilities. So that makes them a very great social change when it comes to thinking about promoting family-based care versus the residential care. Then the Catholic Church has efforts to scale internationally, and this we really acknowledge and appreciate the work that is being done by the sisters, the Catholic Care for Children, which is being implemented in Kenya, Uganda, Zambia, And tomorrow we'll be getting some presentation from Sister Delvin on the work that the Catholic Care for Children is doing. So actually there's great potential. There's great potential for synergy and be able to work together and be able to reach to those many number of children. And also when you look at the regional portrait that was launched in 2023 by Catholic Care for Children, there are many children in the institutions. In the 4 countries that I mentioned, almost 10,000. And then there are also children with disabilities. So there is really great need for the Catholic Church to be part of care reform. And then lastly, I talked about the request. So it was demand-driven. And you know, when something is demand-driven, there's so much ownership. You don't push. There's so much ownership. So our objectives, what the ISAC is fronting for. So the ISAC project is fronting for 3 critical objectives. One of them is to be able to demonstrate that Catholic leaders and structures can be able to promote family care for children. So we are demonstrating that within the Catholic Church. And the second objective is be able to demonstrate that actually residential care facilities can transition into family-based services. And then lastly, through Amecea, catalyze learning through the Amecea region and also through the other archdioceses that we are not in, and also through the other institutions that we are not in. And that's why we are here today, part of that objective, to catalyze some learning, some reflections, and be able to see how best as a church can we be able to push this forward. I'm almost there. The work we are doing in ISAC is actually a very scalable model. When you look at it, it goes right up to Vatican. There's so much potential to be able to scale this work. As we speak, we are only on this one side, working with Amecea, KCCB, moving down to 2 archdioceses, then 2 dioceses, then 4 demonstration residential care facilities. But when you look at this part, there is so much that you can still do in terms of family care for children. It's actually a scalable model. So there is so much potential within the Catholic Church to even be a leader within the care reform space. I'm trying to be fast, I'm almost. So the journey, what have we done? I'll not read line by line, but critical capacity building. There's so many trainings we have done on those technical areas. Case management for integration, supportive supervision, alternative family-based care, so that the institutions are ready to support children back to families. But for those who are not in institutions, are able to be retained in families so that we avoid family-child separation. We have also done a lot of engaging the demo residential care institutions to be able to learn together and be able to accompany them. Most importantly, there is a championess approach. Today afternoon, you'll be able to meet the champions, who are the clergy, religious men and women that really are fronting for care reform within the church structures in terms of awareness creation, in terms of implementation. And for us, we were very strategic because for you to win the mindset, you have to use one of our own to be able to convince us. And that's why the championess approach. We've done a lot of learning. One of the learnings we did, you'll be able to receive from the documents that you'll receive. We learned from some of the dioceses that don't have institutions, like for instance, Kericho Diocese. We had some interviews with them, and we packaged that information just to learn why is it that they don't have institutions. We have also done a lot of allowing KCCB to take lead in terms of decisions, in terms of identifying areas of support, and most critical, policy development. I don't want to get into that because as Father Jacob will be coming here, he'll now be building up on those nitty-gritty of what we have done together. I want to be fast, I'm almost there. This is some of our key achievements, and we must appreciate Amecea, that through Amecea's relationship, we were able to build some relationship and learn on safeguarding with Pontifical Commission on the Protection of Minors. I remember when we were doing the safeguarding training for the pastoral coordinators, the Amecea pastoral coordinators, and the safeguarding officers, we were doing it together jointly with Pontifical Commission on the Protection of Minors. And that's a relationship that we really need to keep because it's really one of the sustainabilities. The general secretaries across Amecea have been sensitized on changing the way we care. The executive board, the chairman of clergy, they have been sensitized. Under KCCB, we've done a lot of assessments for capacity building. 22 dioceses were supported to do family life desk assessments because we realized for you to sustain care reform within the church, you must strengthen the family life desk because we are talking about family strengthening. So there are a number of work we have done. I don't want to get into the nitty-gritty, but we've done those, that's the other side we've done for KCCB, but this side we've done for the 8 national conferences. We've supported them to develop a resource mobilization strategy, which is yet to be finalized, but also part of our sustainability. A communication strategy has been developed. I want to go now to Kenya, what we've done with KCCB. So most of that, I talked about the trainings. We had to work closely with the archdioceses to set up transition help desks for us to achieve the work. And social workers who are employed to support the work. They are here with us in the room. You'll meet some of them today as we talk to the champions. And they have been very instrumental in terms of implementing the work within the church. We had to, there are care reform coordinating committees within the archdioceses being managed by our focal point persons, which you'll meet them in the afternoon. They're actually seconded by the bishops to be the focal point persons for care reform within those archdioceses. And they have been our greatest champions, managing and supporting the transition help desks. We've done knowledge, attitude, and practice survey, which you'll receive the results as part of the products. We have done a lot of sensitizations with the government, even through the ecclesiastical provinces, on care reform, on the policy documents, and Harry has been very instrumental in terms of going around just to sensitize the clergy, the religious men and women. I'm almost there. One of the greatest achievements we are saying is that we are seeing commitments at all levels. Already we are seeing commitments at all levels, and this speaks very well to our theory of change. Critically, we were looking at, can we be able to get commitments? It starts from commitments. So we are seeing commitments from the institution. That is one of our champions, Sister Lucy. She's in the room. I don't want to read that story. You'll receive that pamphlet. It's actually a poster with a key message you'll be able to read. That one is our Archbishop, Martin Kivuva. By then, he was still the KCCB chair, and this was in the Standard in April. And then care reform in Ethiopia, also taking shape. And I'm happy that our champion from Ethiopia, the safeguarding officer, is in the house. I can't pronounce that name. Merhawit, yeah, she's in the house. Yeah, so we are seeing commitments across board. The opportunity, there's so much opportunity that the Catholic Church can seize to be able to push care reform to scale. In the interest of time, I will not read that, but there's so much that we can do within the region and within Kenya in terms of seizing the opportunity. CRS also partners with the Catholic Church at the global level. Actually, that is our CEO next to the cross, and those are part of the staff and the church at the global level. So it's not just happening in Kenya, it's happening at the global level. Lastly, I want us to ponder over this question. I will not need a response from you today, but I want you to sleep over it, and maybe on Thursday, you'll be able to give me a response. And what I'm saying is that there's a tremendous opportunity for the Catholic community to lead, not even to contribute, but to lead care reform. There's a tremendous opportunity. But the question is, how can the wider Catholic community support care reform? especially family-based care for children. So that's the end of my presentation. Thank you.
Thank you very much, Edith. Let us appreciate once again, really. Looking at time, it's already 1 o'clock, and I thought it is important that we abide by that time. So we will break, go for lunch, and then when we come back at 1:30, we continue from where we have stopped. We'll negotiate with the presenters to even be a bit shorter so that we catch up with the day's business. Now, as presenters are giving their presentations, you note all the questions and contributions that you could make. Towards the end, we'll give an opportunity for the interventions. So just take note, write the name of the presenter and the question, then we'll take them all together. Edith has talked a lot about the networking within the church, the Catholic Church. I wanted us to get it clearly because I had a different definition of a church this morning when we were taking photos. I said, now it's time for the church to have a photo. So, yes, and there were bishops and priests and the religious. Now, the current synod is actually against that kind of reflection. The church includes everybody. Everybody must contribute. Everybody. It's talking about communion, participation, and mission being everybody's business. So when they talk about the church, we are privileged to have the bishops because they make it now holistic. But it is not only them, it's all of us. I hope we are clear there. Everybody is part and parcel of the church. And what is being emphasized here is that we need to network and work together. The task should not be left to one individual. Everybody must take part. Be it NGOs, be it the government, be it the sisters, be it the priests, be it the bishops. Care reform should be everybody's business. In fact, wherever you are, you must sniff around and see partners who are also doing the same work and say, how can we collaborate and move together? That's the whole business of coming together here. I don't want to give another lecture. Can we get a prayer for food and a prayer to dismiss this session? Sister, you were appointed to give a prayer at one time. This is your time.
Let us pray. In the name of the Father, and of the Son, and of the Holy Spirit. Our dear Heavenly Father, we thank you for the gift of this day. We thank you for this far which you have brought us. We thank you for the session since we began up to this particular moment. We continue to ask for your Holy Spirit so that he may be able to guide us as we continue to discuss everything and as we come to the end of this day. We ask you, dear Lord, that may you bless the food which is in front of us. As we take it, may it continue giving us strength to continue serving you. We ask all this through Christ our Lord. In the name of the Father, and of the Son, and of the Holy Spirit.
So please, let's keep time. 2:30 sharp. Come a few minutes earlier so that by 2:30 we start the task. Thank you.
understanding and wisdom, that all that we gain from here may be a milestone to continue assisting your people to live a better life, to know you better, and to continue serving you. This is our prayer through Christ our Lord. In the name of the Father, the Son, and the Holy Spirit.
Thank you very much, Father Silvanus. Now we have come for the afternoon session. And I know it's a difficult time, especially after taking lunch. But it's always advisable that elderly people don't sleep in public. So please avoid. So many things can happen and we don't want that to happen. Daydreaming. We don't want daydreaming. So just remain awake. Now we begin from the session that remained in the morning, and this one is on prophetic mission of the church towards family-based care, KCCB's commitment to care reform, and it will be presented by Reverend Father Jacob Ondigwa Nyaga, Director, Canon Law, National Office, KCCB, and they will jointly present with Ms. Elizabeth Ngami, Program Officer, KCCB National Family Life Office. May the two presenters come in front and give them a hand of applause.
Good afternoon. Good after lunch. Thank you. So we are going to have two parts on this presentation. One will be doctrinal. That is the key principles that led KCCB to make a firm decision to support care reform. And then we are going to give you the implementing structure. That is the structure that the church is riding on to implement care reform, achievement, lessons learned, and then we make a conclusion. So our topic is a prophetic mission of the church towards family-based care. And this is KCCB's commitment to care reform. And the first question we are going to ask ourselves is, what is the prophetic mission of the church? And all of us know, or we can imagine, that the church is called to be the voice of the voiceless. It is called to advocate for justice. It is called to give guidance. And that is one of the reasons as to why the bishops accepted that care reform also become a church agenda, so that the church can give guidance, it can be able to advocate for justice and be the voice of the voiceless, and especially of the marginalized and vulnerable. And in this case, we are pointing to the children, and especially the children in the CCI's children charitable institutions. And historically, the church has been doing this work, drawing from scripture and church teachings. The Catechism of the church gives very good guidance that the family is the best place to rear children or to grow children. When you look at the Catholic social teachings of the church, the same is echoed. And recently, we have the papal encyclical like Amoris Laetitia of Pope Francis. And even what he continues to teach us, it affirms that the church needs to support and the society needs to embrace family as the natural place to rear and to grow children. In the socio-Catholic teaching, it is well defined as the natural society, which is irreplaceable. So no institution can replace the family, because it is there that the children experience love, and they are able to be schooled on how to live as human beings. Of course, we appreciate the work that has been done by CCIs, but we believe that the CCI should not replace the family just because of poverty or any other push or pull factors. Key principles that inspire the commitment to the family-based care. We find that there are key principles that we went through. And I would like to give this background. One of the big questions that we had to answer to ourselves and to discuss is whose agenda is this one? And I'm sure those that we got involved in those first discussions, Edith was really admiring the way we were discussing, because we were saying that this is the agenda of the church. Somebody was saying this is the agenda of the government. But then we resolved that it is a multi-sectoral agenda. Neither for the government alone, neither for the church alone. It is for all of us, even the non-governmental actors, the NGOs, and everybody is in it. And this was drawn from the biblical and theological foundations. And there I've quoted just Matthew 25:40, where Jesus says, whoever takes care of these little ones, he serves me. And therefore the prophetic mission is what? It is to ensure that every child has the opportunity to grow within a loving family environment, which mirrors God's unconditional love and care. The other principle is about the dignity of the person. This one I don't need to labor, for sure. His Grace, Most Reverend Anthony Muheria, did a good job on this, that we know we are all created in the image and likeness of God. And therefore, from there we draw that intrinsic dignity of every human person. And therefore we have to ask ourselves, when we are rendering service to the children, is this the best way to honor the children? Do we respect their dignity? The other one is preferential option for the poor and the vulnerable. The church's commitment to the most vulnerable includes children who are orphaned, abandoned, or separated from their families for various reasons. KCCB recognizes that institutional care often lacks the personal, emotional, and social development that family-based care provides. Therefore, the church advocates for the family and community-based approaches that prioritize family reunification, guardianship, foster care, kingship, care, and adoption. Collaborative effort for care reform. When we are realizing and accepting that care reform requires a multi-sectoral approach, then KCCB commitment to care reform involves collaboration with various stakeholders, including government agencies, non-governmental organizations, and the broader Christian community. And that is why we had 2 years ago a memorandum of understanding between KCCB and Changing the Way We Care through CRIS. And that has even given us the opportunity to have the government with us. And we really thank them for the contribution that they have done. This collaboration aims to establish and support structures that promote family-based care, address the root causes of the family separation, and strengthen families to prevent children from entering institutional care. I know His Grace posed a very pertinent question: have we prepared the ground? And for sure, following the case management process, whereby we assess even the family, we assess the child, we assess the person or the family where the child is going to be placed. If those steps are taken care of, I'm not saying that all the risks will be mitigated, but most of the risks will be handled, and we can have families that are ready to receive children and support them to grow. Formation and awareness programs is great. Grace Anthony Moheria stated very clearly that care reform is about change of attitude, it's about change of our mentality, it is about change of many, many things that lead to us supporting institutional care. And one key factor that can really bring about change of mindset is about creation awareness and trainings. And KCCB has really taken this as a responsibility, and we have done a lot of care awareness in all the dioceses. And the implementing dioceses have undergone various trainings that we are going to see very shortly. Advocacy and policy influence. KCCB, leveraging its moral authority, seeks to influence policy and advocate for child protection laws that favor family-based care over institutionalization. This involves engaging with the government to ensure that policies are child-centered, uphold the dignity and best interests of the children, and align with international standards such as the UN Conferenceon on the Rights of the Children. Support systems for families. The church is committed to provide material, emotional, and spiritual support to families to prevent the breakdown that often leads to children being placed in the institutional care. And here is where we are engaging the community, the Christian communities, small Christian communities that live with these children so that they can become a source of support. And this will assure the sustainability of care reform. Allow me now to ask my co-presenter, Elizabeth, to take us through the implementing structure, achievements, lessons learned, and opportunities. Welcome.
Good afternoon. God is good all the time. Thank you. So I'll be taking us through some of the achievements that we've witnessed in the course of implementation of this work on care reform. And just to state that at the KCCB level, the implementing bodies are the Child Protection or Safeguarding and Child Protection Desk, together with the National Family Life Office. At the two archdioceses in Kisumu, the care reform agenda is housed under the Family Life Department, and we are working closely with 9 CCIs. In Mombasa, it is housed under Caritas office, and we have 5 CCIs that we are working with. So some of the achievements we've seen, and especially in policy strengthening, we've done assessment and review of KCCB policies so that we are able to adhere to the safeguarding standards that are set globally. And these are seen as achieve the following milestones. One of them is that we were able to develop addendums to the human resource management policy, as well as the safeguarding policy at the KCCB level. And then we were also able to recently review the safeguarding children and vulnerable adults policy and procedures, which has actually been adopted by the bishops. And these was mostly informed by the new guidelines from the Vatican, as well as the safeguarding standards as well. Then we were able to do staff reference checks, self-declaration forms, staff code of conduct, which is underway, and we've also been able to include safeguarding clauses in several consultancy contracts, suppliers, and recipient agreement forms, because this is a requirement. And so for us to even say that we truly adherence, we were able, or we had to do this, and we did it with a lot of support from CRS, technical and financial. The other achievement is specific to the care reform agenda. So we're able to train on these specific areas. So we did a lot of care reform, national strategy, and legal framework sensitizations across the 4 metropolitans, that is Nyeri, Mombasa, Kisumu, and Nairobi, whereby we were targeting pastoral agents, including priests and religious and lay people, and especially those who are working closely with children and family life offices. Then we were able to conduct safeguarding trainings. We were able to target all the child protection officers across all the dioceses. We were also able to sensitize the CCI workers, including the managers and the social workers. We were able to do disability inclusion training, still with technical support from CRS, whereby this has enabled us, from the team that was trained as TOTs, we've been able to then cascade these downwards to the dioceses, and specifically in Mombasa and Kisumu, we have a lot of families and caregivers, and especially for the parents with children with disability who are benefiting from these disability inclusion trainings. CPIMS, this is the Child Protection Information Management System by the government, which I know that the government officers mentioned about. So our CCI officers have been able to be taken through, and now they have they are live. They were taken through the training, they had to practice, and then now all their data about the children that they are serving is online and accessible to the government, so that we are able to track progress in terms of reintegration of children, but also the number of children who are coming and leaving the CCIs. Then the other one is the alternative family care. This is a key component in care reform, because I know you are taken through the 3 pillars of care reform, which included prevention of separation, family strengthening, alternative family care, and tracing, reintegration, and transitioning. And so for the second pillar, we had to do training on the alternative care. And this is the one that enabled us to, as we are telling CCIs, let us reintegrate children back to their families or communities, where will they go to? So we're able to take them through the different options of care, including adoption, foster care, guardianship, kinship, all that. So we're able to take the CCI workers through all that. Then case management, we trained them. It is a process. And that's why the CCIs did not just transition on one day, but the government has given it 10 years. So from 2022 to 2032 in Kenya. So for the CCIs to be able to do this, there's a lot that has to be happening. And we had the Archbishop talk about family assessment, So case management includes the key components, including being able to do child identification, family tracing, family assessment, just to ensure that as we are taking back children to their families, the family is prepared to receive these children. And then, looking at the key factors that led the child to separate from their family. So case management, it is a process with different stages, and we are happy that all our CCI managers and social workers are fully understanding this from both Kisumu and Mombasa, and we've also been sharing the same messages to the other dioceses so that we can effectively reintegrate children and they do not have to fall back to the CCIs after reintegration. The National Positive Parenting Program, this is a key component as well. And the idea is to really strengthen the families. And I'm happy that that was also one of the emphasis from our Archbishop, that, our family is prepared to raise the children in a safe, loving, and healthy environment. That is actually the goal of the National Positive Parenting Program. And in collaboration with the State Department or State Social, it's called DSD, Department for Social Development. We were able to train our officers in both Mombasa and Kisumu archdioceses, but recently, actually last week, we also managed to train a team or representatives from the family life coordinators from all the 27 dioceses that we have in Kenya, so that they can support this family strengthening agenda in line with the first pillar of care reform, that is prevention of separation and family strengthening. So we are happy that in Mombasa and Kisumu, we have 155 parents who are currently enrolled in the program. They are going through the training, which is taking around 15 weeks, one session per week, so that as we encourage family strengthening, all parents, and especially those with children or with children at risk of separation, can fully benefit. The other achievements we've seen is we did a joint reflection meeting for KCCB, Amecea, and Changing the Way We Care, whereby we brought the champions from Mombasa and Kisumu archdioceses, and these actually, played a big role in consolidating the materials that we are using in this conference, because we are reflecting on so far for the 2 years that we've been implementing this project, what are some of the key milestones, and what is it that we can borrow? What is it that, as now we are telling Amecea to pick these up and take to the other Amecea regions or conferences, how best can they do this? And so we're able to do that. Then Edith mentioned about this, the learning agenda on family-based and community-based care for children. We did this in Kericho and Mombasa, a parish in Kwale, because we were looking at, for the places where we don't have the charitable institutions, how best have they been caring for children? How is it that they do not have CCIs? And so we picked a lot of learnings from that, which we are also hoping to share with you. Then resource mobilization training, this is also another milestone we got from the support of CRS. We were trained, targeting dioceses, especially the Caritas offices, the family life, the child protection, the pastoral offices. We are looking at, how can we manage to continuously do the work we are doing? How do we best resource mobilize? Then capacity assessment for family life desks. This was done for all the dioceses, and part of the learning tools we are going to give you by the end of this conference will have outcomes of, where are we at as a church in Kenya in terms of family life desk. So you will be able to see that. And then social cohesion for disability inclusion, we had a team from Zambia who visited 2 CCIs, one in Mombasa and one in Kisumu, and it was just to pick learnings. How are we in Kenya doing transition? Or actually, how are we reintegrating children with disability? So we had a team that came to learn about that. Lessons learned from the work that we've been doing. The first one is that implementation of case management system has made reintegration work more effective. And this is because, as I said, it is a process. It takes you through different steps that have to be followed so that children are well reintegrated back into their family. Then working closely with the government is paramount. We could not do this alone. We could not do this alone, and that's why we also have the government representation here, so that we can fully collaborate with them. More community awareness on disability inclusion is very important. That is one of our key learnings. As we are here and we have stories, and every one of us here has a story about a case of a child within the community where we come from who is not accepted, who's discriminated, a child who is hidden, So how do we best manage to create a lot of awareness, make people understand that children with disability deserve to be loved, deserve to be cared for, and deserve to participate in the community just like any other member? And how do we enable parents to accept these children and even to best know how to care for them? So this is a very great learning, and we are hoping that we will be able to create more awareness, not only in our dioceses in Kenya, but also across the Amecea, other conferences. Advocacy and lobbying for disability inclusion is required, and this is still on the same, so that within the policies that we have, we see that especially that these policies are implemented. Reintegration and transition of care of children is multi-sectoral. None of us can do it alone. We have to collaborate, and we have to look at different angles. As we look at the CCI and the harm that maybe CCIs have, what about the family? How do we strengthen the family so that we do not have more children separating from their families, but also when the families receive their children, they can fully take care of them? And I think the Archbishop Muheria emphasized very well on that component. So we have to look at this from a multifaceted angle so that it is not a one approach. Opportunities, one of them is that we are happy that the church leadership is fully committed in this. We were only able to implement care reform upon the approval of the Conference of Bishops in KCCB, and so that has given us a lot of confidence. And even as we continue to learn, we continuously are engaging the bishops so that with their blessings we can manage to do this in the right way. Many collaborators in the care reform agenda. We are happy that today here we have a lot of other organizations who are here to share with us what they are doing in care reform, because some of them have made a lot of milestones, and the government also is with us here. Well-defined church structures for sustainable implementation of this care reform project, because as we are looking at the key components that we are focusing on, we are really looking at using the dioceses, the deaneries, the parishes, the ecclesial groups within the church, so that once we capacity build the different pastoral agents who are involved in those different offices, then it will be easier for us to do this work. So as you will notice is that, and from the milestones I was sharing, a lot of it has been capacity building. So once the leadership is empowered, then our hope is that we will be able to transition well. Goodwill and buy-in of the CCI administrators, this has been very important. When we started working and we called upon the CCIs, all of them were able to come on board, and they've been very supportive, because for us at national office, we can only, work with them. We cannot go down to implement. So we are supporting them, and that's why the work has been going on. Supportive and receptive community members, and especially on the disability inclusion. There's a component that in disability inclusion targets the communities. One targets the parents and caregivers, the other one targets the communities. And so far, we've seen a very close collaboration, because we are saying, even if we empower the families alone, if the community itself is not transformed, then we will not see the change that we are yearning to see. So we are working closely with both community and the parents and caregivers. And so far, the collaboration has been great. The champions approach has really been helpful, and we are happy that we will be listening to some of them who are here with us, so that they tell us how their experiences have been and how can they share, or what can they share for other countries or conferences, so that you can use the same in terms of influencing the care reform agenda. Thank you so much. I wish to invite Father to conclude.
Thank you, Elizabeth. So in conclusion, what we are saying at KCCB, do you want to save the children, to safeguard the children, to protect the children, strengthen the family? And therefore we are saying family-based care for all children, transforming all. We want everybody to be on board so that we can be able to take care for our children in the best way possible. I want to recognize the lead persons and the team from the archdioceses. Without them, we would not have done much. And therefore, the lead persons from Kisumu Archdiocese, together with the other team, that is the champions, please stand up. From Kisumu. Yes, thank you. In Kisumu, in the Archdiocese of Kisumu, the transition desk is based on the family life desk, which is led by Father David Osaka. Thank you. Archdiocese of Mombasa, the lead person. I'm not seeing also the social workers standing. Are they not here? And the champions, yes. And even the CCI administrators that we have been working with. So at Archdiocese of Mombasa, the model is that the transition desk is based on Caritas office, led by Mrs. Margaret Masipo over there, the director of Caritas, and then supported by the others, Makofi Kwao. Thank you, and may God bless you all.
Yeah, we appreciate Father Jacob and Miss Elizabeth for the beautiful presentation. Please, let's clap for them. We are moving well. Now we have a panel discussion. Father Silvanus here will explain how the panel will be like. I just hand over the mic to him. Thank you.
Thank you, Father. Good afternoon. So you will agree with me that if we remember the session that we were given by Edith and what has been given by Lisa and Father, we agree that there's a lot that has been happening. And so this session this afternoon is a more practical session. It will be in 3 phases. We shall be hearing real voices. Remember the Archbishop stressed this morning that the care reform is not an abstract idea. It is something down on the ground. So this evening, this afternoon, we shall be meeting champions. We were told that there was a championess approach that was used in the demonstration archdioceses of Mombasa and archdiocese of Kisumu. So we shall have a panel of champions here who we are going to interact with in a panel. We shall ask them lead questions, and after that, after they express themselves, we are giving us the experience, we shall bring it back to all of us so that if we have questions to ask them based on the experience, that will be the first part of the session. The second part is a journey of learning. A lot of documents have been put together. As we are moving into this next step, it's good that we know what was the process of putting together this documentation, and we shall be led through that by our very own George, who is very, very fundamental in this. And the final part of it will be the launching of these learning products, so that as we move on, we know that we have ready material at our fingertips to be able to use. So without wasting much time, I would like to invite our panelists, our champions, to come and take up their seats. We have Mrs. Margaret Masibo from the Archdiocese of Mombasa. Let's clap for her, please. We have Sister Lucy Kilonzo, also from the Archdiocese of Mombasa. Clap for her. We have Father David Otieno Osaka from the Archdiocese of Kisumu. A clap for him. Mr. Collins Omiti from the Archdiocese of Kisumu. A clap for him. And Mrs. Mildred Konyach from the Archdiocese of Kisumu. An applause for her. So allow me to very first introduce our panelists, our champions on the care reforms. On my extreme right, we have Mrs. Margaret Masibo. Ms. Margaret Masibo heads the Integrated Human Development Commission of the Catholic Archdiocese of Mombasa, with a special focus on the Caritas and Stella Maris. She's a champion for recognition of marginalized groups, including children, especially those separated from their families, refugee migrants, and a special mission for the seafarers. So she's a certified mediator, a champion, and focal point person in the care reform in the Archdiocese of Mombasa. A special applause for Margaret Masibo. Followed by Mr. Collins Omiti. Mr. Collins is an occupational therapist at Jabondo Center for Persons with Disabilities under the Archdiocese of Kisumu. He works with children and adults with various disabilities. He's a speech and language therapist supporting children with various learning disabilities, and also a consultant on matters disabilities. So he's a social worker handling the care reform program, and he's also a care reform champion. An applause for him. He's followed by Mrs. Mildred Konyach. She's a social worker at Rangala Baby Home, which is under the management of the Franciscan Sisters of St. Joseph. Mildred has a passion for children and has worked in the residential care facility for over 5 years. She possesses a diploma in social work and community development. She's our care reform champion. An applause for her, please. We have Sister Lucy Kilonzo, who is a member of the Sisters of St. Joseph of Mombasa and an administrator at St. Bakita Rescue Center in Kikambala, that's in Kilifi County. She's a care reform champion from Mombasa. Makofi kwake. And finally, we have Father David Otieno. Father David is an ordained priest in the Archdiocese of Kisumu. currently serving as the parish priest of St. Francis of Assisi Catholic Church, Mamboleo in Kisumu. He is the family life coordinator for the Archdiocese of Kisumu and a champion and the focal point person for the care reforms in the Archdiocese. An applause for him. So these are our care reform champions who will take us through their experiences. I have lead questions, which they will take 3 to 4 minutes to respond to these questions. And as they explain themselves, you also note down if you have any questions that eventually when we open the panel to all of us, we can be able to interact. So my first question goes to our champion. Oh, you want to dance? Okay. Thank you. Yes. Kevo can lead us in that. Please kindly come. Kevo. Come and make us dance before we can go into this.
No, you do what I'm doing.
Oh, I do.
Yeah.
Okay.
So everybody do stand there.
Thank you, Makofi. An applause for him. Thank you, Father Kevin, for that energizer. We are all energized, and I think our champions are equally energized. So I'll pose a question to Madam Masibo. We are in this context, and we want to understand who is a care reform champion. And then, what roles have care reform champions played in the reform efforts within the Catholic Church structure and beyond? And why do you find this approach very important? To you, Margaret.
Hello. Oh. Good afternoon. Thank you, Father, and all protocols observed. A very good question. And as we've been going through the sessions and I've been listening, I think everyone in this room is a champion, aren't we? Yeah, from here we can advocate, we can talk about it, and we know that for sure this is the way to go. So for Okay, again, good afternoon. What I was saying is that from what we've gone through the whole day, from morning, for sure everyone in this room, including those who have left, the bishops who are here, and those who are still with us, are champions. From here, you can talk about it. We know, as His Grace told us, that we have to dignify the child. And home setup is a place for the child. So a care reform champion is one who advocates, who talks about it, who creates awareness, who tells everyone that children should be with their parents. Children should be in the community, not in homes. And it is a very good tool or a process that is used to ensure that this message gets to the people, that every forum where you sit, talk about it. I know, and I've heard from my colleague champions saying, whether they're at home for Christmas or Easter, they're talking about children. They're talking about the place of a child, that we have to do what it takes to ensure that the children's life are dignified, they are with their parents, or they are in kinship, they are with parents and not in homes. So that is the work of champions, to ensure everyone knows, everyone understands, train others, ensure resources are directed to the place where they should be, to those homes where, to the parents, train the parents, give them positive parenting. Let them know that they have a responsibility and that the children belong to them. That's the work of the champions. And yes, it is a very, very important strategy used by care reform to ensure that, yes, we have people who can talk about it. You know, when no one is talking about this agenda, then it belongs to no one. We can come here, we are trained, we are sensitized, then we go home and sit back. But with this team and others who work with us, every day, everywhere, we are talking about this care reform, that it has to work, and it is the way to go. It is a very, very important strategy, and we thank God that the church has been called to do this, that we are part of this agenda, and that we are the ones moving this, and everyone else in this room. I was happy to hear everyone saying, even those who are hearing it for the first time, I heard from Akweka, I heard from government, I heard from everyone, that yes, we have accepted and we are going to move with it. So we have very many champions from here. Thank you.
Wow, that's so good. You can clap. I think something I'll never forget when I was doing my philosophy course, one of our professors told us, what is knowledge? And he says, knowledge is what you remember after you forget everything. So I think after these sessions, if we only remember what she said, our work is so simple. Champions need only to go and tell people that children belong to families. Thanks a lot, Margaret. An applause for her again. A good hearty applause for her. Connected to that, we have a lot of misperceptions about the care reforms. I would like to direct this question to Mildred. What do you think is the most biggest and common misperception about the reform care? And how has that championess approach been helpful to you to be able to solve this misperception?
Okay, thank you, Father, and good afternoon once more. Just as Father has asked, there are some misperceptions that people have had concerning the care reform. Some of them, people tend to believe that children should just remain in the CCIs because they tend to believe that donors pump a lot of money in the CCIs. So most of them think that the CCIs are the best place for the child. And as a champions, we tend to sensitize the community, telling them that the family is the best place for a child, because a child needs to be loved, to be cared, and the child also needs a sense of belonging. Thank you.
Thank you, Mildred. You understand, even as we handling the care reforms, there are also misperceptions. As we try to score in having all our children reintegrated in a family-based society, there are thoughts that there are also funding that goes on in CCIs. And this will bring us to getting one of our social workers who has been and is an administrator of CCI, and this is none other than Lucy, sister, to be able to respond to this question. Sister, can you share any positive experiences or successes you have had in your role as a champion? And tell us what factors made it successful. Mention if there are any challenges. And also, just tell us what is that one thing that you have learned in this process that you didn't know before.
Thank you, Father Silvanus. All protocol observed. Good afternoon. Okay. All of us have an identity. All of us belong somewhere, isn't it? And all of us have a sense of belonging where we come from. And you'll find that all this you have gained because we come from a family. There is that family which has made us. It doesn't matter the background. Some of us, we have had some backgrounds, and even when we are growing, we didn't grow in an environment that we thought would be better, and an environment that maybe we or wished to have in life. But in that case, we grew there, we remained there, and that background, that family has made us who we are today. An experience that I've had as an administrator is that a child is a unique person. Every child is unique. And every case that you encounter from any child, you are supposed to treat it differently. So there's that aspect of uniqueness and that aspect of treating things and looking at things in a different perspective. For me, what has really made me on making me to be part and parcel of this journey, especially the care reform journey. It's all about inclusivity. And inclusivity is not all about the disability, but even other children whom you meet, while you treat them in a unique way, and in their cases differently, there is a place where you need to make them feel that they also belong. And even when they're the CCI, they can be able to mingle, interact, and even build one another. So that sense of inclusivity has made me to be able to change my attitude and to look at things in a different case, whereby I can be able to treat each and everything according to that need. What is that need? What arises? What do I need? What is that need at the moment? So I had a child who has disability, and for sometimes for me, I couldn't focus on that particular child. We could say that, okay, the child cannot speak, has that, we call it, speech. Yeah, speech, that was the term I was looking for. So the child cannot communicate. But now, the rest of the children could be like, this one cannot communicate, so he cannot play with us. We cannot even engage him in some roles. He's just there to be. So after I've been encountering some trainings, we have been taught, then I went back and asked myself, what can I do for this particular child? This also particular child needs that love. This child needs to feel like he's part and parcel of the rest of the group. So I started to change my attitude and perception about this particular child. So each and every moment I could see him in isolation, I could call him, maybe sit with him, tell other children, just go with him, include him in the games that you are playing. He cannot talk, but you can tell him, go and bring that ball. The boy could run and bring the ball. So slowly by slowly, I saw there's something growing in me and even in the entire, the children and even the staffs. So we started including him very little and little in some things that we could do. And even today, as I speak now, the children have fallen in love with the boy. Yani meaning that they'll just miss his presence. Whenever they come from school, they're like, is so and so there? Sister, are you planning to take him away? So they have developed also that love, because I had to call them and told them, no, now this is your brother and this is the way to go about it. So for me, that aspect has really made me to grow, and I'm always proud of it, because I can say that care reform is really, it's something that it is workable. And if we join hands and walk this journey, it is a success. Okay, some of the factors that have driven me, I can say the passion for these children. You feel that as a child who grows, there is that emptiness that child feels, and especially he or she needs an adult to feel it. So that love. And again now, the value of the child. Looking at these children like these are gifts from God. And if I see that, I can say, if someone gives me a gift that someone gives me. So God has given me these children. So I need to value them, knowing that these children, I should treat them with that love, with that care, giving them a listening ear, because by the end of it all, this is God whom I'm ministering to. If I take good care of this particular child, I'm touching the heart of Christ. The other thing is the church. the teaching of the Catholic Church. Not only the Catholic Church, okay, there's the social teaching of the church, the Bible, the Word of God, everywhere. You'll find that even Christ, when he was teaching, he could say that the kingdom of God is like that one of the little child, comparing his kingdom and the little child, the humbleness of the child. That child is very innocent. So who will be there to stand for that particular child? It is I. The other things, the legal frameworks, and you find the constitution is there, the constitution of the country. The constitution of the country, the child acts are there. So these are some of the things that they are there to help us recognize the rights of these children, and we be able to protect them and give them the care that they support. The challenges are there, you'll find that. And the most key challenge that has been brought about in this conference, the dysfunctional families. If we may come up with something that we come up with ways that like creating awareness to this particular family, sensitizing them, these children will not run away from their families. But all this will be able to be catered up when we strengthen the families. We need to strengthen these families so that they may create a conducive environment for the children, that they will feel that now this is our home. As we come out from the CCI, our families are good. They will never run away.
Wow, that is great. I think, thank you so much, sister. Continue doing what you are doing. You're becoming voice for the voiceless, as we are told, demonstrating that Christ is present among his people. I'll move on to Mr. Collins. You are a care reform champion. Surely you've received some support. Maybe you can tell us what support you've received to prepare yourself for the task ahead. And what additional support would you have liked to make your work even easier?
Okay, thank you, man. Thank you so much, Father. Good evening, everyone. I think it is approaching evening. As a champion, care reform champion, and as a social worker, and as a medic and occupational therapist working with children with disability, we were prepared. It is said that to whom much is given, much is expected. You could see the presentations there that were given by CRS and KCCB. They were all about some trainings that have been conducted. And actually, we were prepared before we started this journey in care reform. We were fully prepared, equipped with knowledge and skills, how we were going to reach out to the community, reach out to other members in the society, and talk about care reform. The trainings we received prepared us both physically, emotionally, and psychologically to encounter any challenge, to interact and overcome any challenge that we could face in the community. Through the trainings, we were able, initially we could not even know the best way we could reintegrate children with disability. I work with children with disability, but that aspect of reintegration was a problem. But after the training, series of training we got organized by CRS and KCCB, I was able to know the right way to take. Another thing I came to realize during the training is that care reform is a journey and it is a teamwork. You cannot do it alone. That is why I started with my staff members. I educated them on care reform together with my administrator who gave me that chance. And now we are working as a team to ensure that we prepare the ground. We prepare the ground safe before children are reunited with the families. You talked about the support. We have received a lot of, additional support. I would wish that I work closely with the government agencies, like the DCS. I work with the religious leaders, the clan members, because they have a very, very key role when it comes to matters to do with care reform. One, when we have children who are running away from the family due to violence, they are traumatized. Psychologically, they are disturbed. But if you take them, you link them up with a religious leader or a priest, then they can have some counseling sessions before preparing the child to go back with the family. Or even the family themselves are going through a lot. Psychological issues, trauma, violence, and the rest. These ones are issues that can be tackled by a religious who is an expert in counseling sessions. Then the clan elders, the chiefs, all the local administrators, they will pave ways for us. We work collaboratively with them to ensure that they inform us on any separation case that may lead the child running away from the community. And even during our work in the community, they are the engineer. We are going to work with them. We are the engineers, but we work very closely with them to ensure that the reintegration process becomes a success. Because it is said that if the ground is not made safe, then this child, the integration process will be compromised. Because you cannot assume that you take the child back at home, but you have not changed even the perception of this community towards children with disability. Now we tell them, through the training of disability inclusion and social cohesion, we were told that we look at the aspect of the strength of a child. But if you go to a community whereby the child has been maybe neglected due to disability, they tell you this child uses wheelchair for mobility, cannot walk. What is the importance of this child to me? But now, through the trainings that we got, it shaped us. We were fully baked to convince these parents that just like any other child, this child who has got disability has got abilities, and they can perform just the same way these other children can do. And actually, I can convince you that the community have begun changing their negative perception towards children with disability. Thank you.
Thank you so much. Thank you so much. In summary, reintegration requires that we all participate, all stakeholders be incorporated so that we can make this process a success. Father David heads the Family Life Office in the Archdiocese of Kisumu, and I would like to draw from your own experience how religious institutions, policymakers, organizations that are working on care reforms can better support champions so that they can be able to sustain their work. And also, what opportunities do you see out there that can make the champions thrive?
Good afternoon. To answer your question well, I request that I give a brief background on how we approached care reform in our archdiocese. When care reform initiative was introduced into our archdiocese, the Archbishop invited all the priests, and we all converged at Ukwili Pastoral Center, and we were taken through a one-week training. At the end of the training, on the last day, all of us made a commitment, and we took upon ourselves the name of champions. That we're now going out to speak about care reforms as ambassadors, people championing for a shift from residential care to family-based care. So after that training, we all went back to our respective parishes, because all of us were priests. And each and every priest took the message to his parish. Like myself, I'm in a parish, and this is the approach that I took. On Sundays, I would spare time to speak about care reforms to parishioners. When I'm meeting small Christian communities during my normal pastoral work, I would always spare time to talk about care reforms. When I'm celebrating masses in a family, maybe a child has graduated and have been invited by family to go and celebrate mass, I could also take time to talk about care reforms. During funerals, after someone, or even during someone, I could take time to talk about care reforms to the congregation gathered there. So in church, I would meet Catholics. In funerals, I would meet Catholics and non-Catholics. And that is the approach that many priests in our archdiocese took after the training. And I remember we also could meet, each and every dean could assemble his priest during deanery meetings, the regular deanery meetings. And they could even invite lay council to talk about care reforms. So in our archdiocese, as I speak, the message is coming from all the corners of our archdiocese because of the champions who are trained. So according to my experience, an initiative like this, an agenda like this, succeed when it is anchored on a system or a structure. I strongly believe, based on my experience, that if the church opens up its structures to the care reforms, I think the champions will succeed. Another thing that I also noted during my engagement is about educational policy makers. I remember when I was talking about other options, family-based care that are available. A woman stood up and asked me, "Father, it is good that we're talking about family-based care and talking about adoption. Do you know how tedious it is? Do you know how expensive it is for you to adopt a child? There's process that you are subjected to." And I realized that if the policy makers if they make laws that kind of favor, laws that are conducive to adoption of children, I think the champions will succeed in their work. It's like we are going out, we're talking about, we are giving a message about alternative family care, but there are some obstacles which can be removed. Another thing that I also noticed, and this one goes to policy makers, the law should be very strict. The law should discourage, or if I put in a better term, the law should provide that residential care should be the last option. Should be the last option through the laws that are promulgated in the land. And another thing that I also witnessed, or I experienced, is about, the organization. Because this is, as you had mentioned, that it is a multi-sectoral approach. The champions need to be facilitated. The champions need to be economically empowered. Somebody said that you cannot, the church is not built only on a few Hail Marys, but some coins are necessary. So, after training a champion, after training champions, they need to be empowered to go out and give the message. Are we together? Little money is needed for an initiative like this to succeed. Opportunities. I'm talking about the opportunities that are there, that I experience as a champion. The first one, level of trust. People trust the church so much. If an agenda like this is being driven by other stakeholders and the church is not, is not brought in, you hear people posing this question: what is the church saying about this? I remember even during COVID, when people were being asked to go for the injection, many people were waiting for the church to speak. And when the church spoke, majority were now coming out. The level of trust. The masses trust the church more than any other person. So that is an opportunity for us to go out and give the message. Another opportunity that I also singled out, the structures of the church. The structure of the church. That we have a well-defined mechanism from top to the bottom, from the archdiocese, deanery, parish, local church, small Christian community, to the last person in the society. That is something that we should bank on and tap on. The last one, the last opportunity that I also singled out during my engagement is the forum that we have, the forum that priests have. I talked about myself going out during burial, conducting a burial mass, and at the same time sparing time to talk about care reforms. I talked about myself visiting families during normal family mass, and after that, since sometimes the family invite other families, so I take that opportunity to also talk about care reforms. On church on Sunday, I have 3 masses in the parish. The first mass is full. The second mass is full. Surely, priests who are champions, we have forum. I end by saying that this exercise, this initiative, the church can use its structure as a vehicle of cascading it down to the society. Asanteni.
Thank you, Father. I think we have the structure, we have the trust, and we have the forum. So as we come from here, we know that each one of us can be able to participate in a specific way. Those are the voices of our champions, as you've heard them. I'm sure they are real champions. You agree with me, isn't it? Let's clap for them again. Now, I'll open the forum to all of us. Because of time, just a few questions, maybe 2 or 3, in case anybody has a question. You can ask the question maybe specifically to a panelist, or you can throw it to the panel, and we shall be able to respond somehow to those questions. The forum is open to us. If you have a question for any of the panelists. Yes, Senior.
Congratulations, our panelists. I want to confide in you, the champions. What has endeared you greatly to the masses and to your entry into care reform, number 1 is trust, and that is very important. 2, you have joined this league with fresh thought and gentle behavior. Maintain that. Now, I want to ask, based on your experience, the school of thought driving the care reform agenda is grounded on the finding that 8 of the 10 children within residential care, they could be having biological families or extended families. What is your experience What is your experience? Could that school of thought be just convenient or accurate based on your experience? 2, the making of a champion. The making of a champion. The experience that we have in the field, that some of the administrators, you get too much attachment to the children over time, to the extent you don't want to let go. Some of you, instead of celebrating exit, you cry and shed tears over it. How have you managed this attitude to become a celebrated champion?
Those are very practical questions. I think this can go to those who are running the CCIs. Sister should be in a position to respond very accurately to this. Maybe you can respond to the first question, and even by extension also to the second, if you've had an experience of that.
Okay, as what Senior said, it is true. 8 out of 10 children in a CCI, they have a family. And you'll find that some, when we do what you call tracing, you'll find that that is where you'll come to understand that these children have been having that, some they lie, but after you make some follow-ups and even bring them close to you, a child needs to, you win a trust of that particular child for that child to open up to you. So some of them, they will open up to you, and in the process of maybe child identification, they can lie. But when you do you go for some family assessment, now that is when you'll come to realize that the information that this child has given you, it is not topping up to anything. It's a very different information. But in the process, after you bring that child close to you, then the child opens up, and you'll be able now to make that the tracing can become successful, and then the child is being, the process of reunification starts, and this child will be reunified with their family. Okay, the issue of making children we are more attached to the children, that is true. But again now, as we continue to learn each and every day, because each and every day it's a learning session, we learn. So we have learned that we have to come up with that detachment, the spirit of detachment, that these children, as much as we love them, we should not now do it, we overdo it. Let me use the word overdo. Because when we overdo it, that is when you'll find that we will cry when reintegrating these particular children. But if we just take these children, treating them equally, equality is the key. If you treat these children equally, the spirit of attachment will not be there, because you'll always see that this particular child, the love I'm giving, the care and everything, it's equal. But when you take a particular child and you own that particular child, then now that is when you start experiencing some of those challenges.
Thank you. I recognize that we have a lot of richness here in terms of what we run. So I would like to push these questions not only to the panelists, since all of us are in this world and in this field. Maybe we have a better experience also based on where we are. I'll give the first opportunity to His Lordship.
Thank you very much. I'd like to say something about the shedding of tears because of the attachment to children, that the facilities and sisters on the facility, that they get attached to these children. There is one of the sisters who shared with me back in Zambia during the implementation process of reintegrating children into families, that one day they visited one of the families and they found the condition, the economic condition of that family, that the child was subjected to abject poverty, the quality of life in the facility was far much better than what they found in that family, where this child, who was with them for some time, has been taken to be reintegrated. And the sister shared that she shed tears. So it's true, they shed tears. Now, in that case, what can be done? Especially that our economic conditions, I don't know so much in Kenya and maybe Uganda, but in Zambia, we have some families who are really suffering, especially some of us who are coming from rural dioceses. You can see poverty. And if some of those children are coming from these places, I have no answer, but I just want to pose this reality to say, what can we do in such cases? So, and I think they shed tears, it's true. And it's worth it, you know. Thank you very much.
Thank you, Your Lordship. I think this is also a sharpening tool to us as we implement the reform and the care. As we're talking about strengthening of the families, maybe a deeper research on what is really the situation before we are integrating our children. Thank you, Your Lordship, for that observation.
Thank you. I think Jedun Konyango has a good point and a good question, but it might not please the speaker very much, because before these children are taken, the 8 out of 10 must pass through the government hands, and he's a government officer. Why does he allow you to go and come and ask a question here? Number 2, shedding tears is proper. If he's a fan of football, you'll see footballers after scoring and winning, they will shed tears of joy. Sometimes they shed tears of joy because they have done something good and they are happy with what they have done, not because they are crying for the person they are leaving. So, Mr. Konyango, I'm sorry if I offended you, but
thank you for that, Kevo.
You always tell us taking risk is the policy, isn't it?
Thank you. An applause for all those who have responded. I think that is telling us that we need to have a closer working between the office of the DCS and also children who are coming to us, so that as we are starting this motion of working together as stakeholders, we have a common way and a common stand. Yes, is it a question or a comment about that? Okay, thank you.
Okay, thank you very much. The question was very valid. 8 out of 10 have parents. And the answer is just very simple. We have built, over time, people have come to believe that the institutions are the best place where children can be raised. They can go to school, they will sleep well, they will eat well, and they're in the hands of sisters. Holiness, formation, what else do you expect? So you find people go to an extent of lying, and they will even kill and bury the parents who are alive, so that children, through the government officers, they find their way into institutions. And sisters will get the letters that this child is in need of being admitted in your institution because the parents are dead, and yet they're alive. So these are just things that we have to unlearn, because as Bishop has just said, poverty. These are the things that pushes us even to lie, that people are dead, so that children can find a place where they can just even have a meal or sleep on a mattress. So the question which Bishop has just posed is very valid. What should we be doing to support the families that are in abject poverty that need support to help the children? Thank you.
Thank you so much. Thank you so much for that contribution. There's a lot to unlearn, to change the mentality, as we had this morning, and also to include the government officials to be able to assist us. Let's hear what he has to tell us.
I want to defer to the government.
Number one, let me just mention quickly the most misunderstood concept about care reform is that the government is closing down the CCIs. I just want to correct that. We are transitioning. And I wish people would understand the concept of transitioning. If I give an example of the education system in Kenya, we have transited from one form of education to, me I started with, ile ya kwanza kabisa wazee, I eat for, wacha iti, ile ya kwanza eat waje? Ile ya kwanza, wacha hii ya CPE, CPE ni wale walika ya 60 years, wale wa hapo bele, ilitu waje? System of education in Kenya was called? Hata wengine hatujui. Now, tuanze na hii ya 60s, 19s, inaitwa waje ya CPE? From CPE, we transited to a system called 844. From 844, we transited to another system called CBC. All right. Okay. So we transited to these other systems. Let me ask a very simple question. Was there any time education system in Kenya was closed down? We just transited, right? The same thing we'll be doing in transitioning. We are just transitioning from one system of services where we give and offer so many services to children who are in need of care and protection. We give them services when they are institutionalized. Now we want to move from that. We continue the same, giving the same services to children when now this time they are not in the institutions, but back to family and community. So please do not use that word because that is not a government word. We are not closing down. And if there is any word from the government document saying we are closing down, come and show me. We are going to do amendment. That is number one. So we are not closing. In the other case is about the policies. And I heard that we need to make policies, blah, blah. Up to now, today, I sit in the Department of Registration and Licensing. The moratorium that was issued by the government on 2017 is still encouraging people not to take children back to institutions. That's why we are not registering new CCIs anymore. We are not registering any new CCIs. And when we are even looking at, I love Catholic so much. I almost became a father sometimes years back. I don't know what happened. I was in seminary for 7 years. Don't ask me what happened. The last you need to see me behind the... But what you're saying is, like what now we are having, we regulate these institutions very closely because we want to move from this one. So about policies, there are so many documents written and so much of it, including the new Children's Act, the current Children's Act, that is encouraging alternative family care rather than institutionalization. So apart of policies and documents, we have enough. What remains now is just implementation. So when we're talking about now this closing, people say we are going to lose jobs, workers will lose jobs. In fact, we're doing three things: repurposing infrastructure, redirecting resources, retraining and redeploying the staff. Now those three things, in fact, we're going to have more jobs for our staff than before. Anyway, we didn't have to go through these things, but those are some of the basic things I wanted to say, that we are for these ones, and the moratorium still stand there. We are not registering. When you bring an application for license, I will look whether you have ever been registered. If it has never been registered, I'll just give you an acknowledgement and say, please, you are not successful, because the moratorium is still effective, and I don't think it lifted any soon. So we have all those policies, and I think they're doing well, and we're encouraging people to be able to take children back to home, whatever we're doing. In fact, sometimes I'm tempted even to require the qualified application, but on the other side, we see we have 10 years, and within 10 years, we still need to regulate these institutions. So we are well on course. Thank you so much.
Wow, that's a good input. With that input, I'm tempted to, he's talked about a lot of documentation that they have, and we are supposed to be hearing something more about the documents that we've gathered. So I'm seeing a lot of hands, but my time isn't really favorable.
Just wanted to make a comment about the issue that our bishop has raised about poverty. And when we are talking about care reform, we are saying that we understand that some of the children in the charitable institutions are there because of poverty. as one of the push factors from the family to the CCI. And what we are recommending is empowering the family. So the family that is living in poverty can be enrolled into an socio-economic empowerment program. And that's why we are saying that let us work together. Like within the diocese, we can identify the Caritas office, which has a lot of socio-economic empowerment programs. So they can collaborate with the family office and the child protection office so that we look at what are the root causes that are driving these children to the CCIs. How can we best address those? If it is issues of abuse, then we empower the community and the family around social protection or safeguarding of children. If it is poverty, then if it is, all the factors that really drive children, let us look at addressing those challenges so that in the long term, we do not have, children institutionalized, because if we empower the family, actually care reform is a collaborative approach, working closely with the parents because they need to support the journey of raising their families. So I think it's important to just mention that. Thank you.
Thank you, Elizabeth. I think due to time constraints, I know we have so many questions, but it's just the first day. So maybe we will put down those questions, even coming from all the sessions we've shared this morning, so that all the questions can come to the desk of the coordinators. Then we can see how they can be apportioned, because we still have two things to do, which I was saying that, first of all, let us thank our panelists, our champions. Let us clap for them. Thank you so much. Thank you so much. You can take back your positions. We still have a journey to be taken through, a journey that is going to give us an overview of documentation and the process and the learning products that we have, which eventually we are going to launch those products. So it is my humble duty now to invite Mr. George, the safeguarding advisor at Amecea, so that he can take us through this overview on documentation. Let's clap for him as he comes forward so that he can be able to take us through this process.
Good evening. Good evening. I hope you're not feeling very tired. I know it's been a long day. I appreciate the patience and the energy and the many questions that are coming out of our deliberations. Thank you, Father, for leading us through that session. I want to, in a very brief way, share with us a component of this particular conference that has taken a number of months to prepare, and that is the documentation process. We started this process sometimes in March of this year. And I am glad that this is finally coming to, do I say to a completion or to a new start? A new start, yes, I love that, a new start. Because I want to believe that some of the products that we'll be sharing this afternoon or this evening will actually start a process of helping us to rethink, to reflect, and to reimagine care reform within the church. And this process, we basically undertook this process as Amecea as part of our commitment within the care reform initiative that KCCB has been undertaking. We've shadowed KCCB since this process started. I have been part and parcel of the journey that KCCB has taken. I have been in a number of their meetings, in their sensitizations, in their trainings. And my role has simply been very simple, to just observe, to write down notes, and to reflect on those notes. And Father and Elizabeth, thank you for giving me that opportunity to shadow your work. I have enjoyed the process. I have learned a lot. Today, as I look back at the kind of a process you've taken through, the different participants and different people you've worked with, I am proud that quality work has gone into this care reform initiative. Thank you so much, KCCB team, of course led by the two, for this great work that has been done. As we think about documentation, I want us to read together, kindly read together with me whatever is written there. Starting now, let's read together. My Lord Bishop, when is the last time you wrote a love letter? Oh, no, sorry. Yes. Yesterday, Bishop wrote a love letter. Serious. Interesting. I use that quote to basically help us to reflect on the importance of documenting our work. Many times, the weakest link in our program implementation is actually documentation. Many of us would probably be very good in writing good award-winning proposals. And that is given because I know most of us have implemented very, very nicely funded grants and projects. Many of us are very good in project implementation, coordination, management, resource allocation, and all that, directing resources. Very good. But if you look at most of the times, there are two areas that we do not do very well. And one is monitoring and evaluation. We are not, most of the times, we are not very good in that area. But I want to add the second one and say that oftentimes we are very poor in documentation. And this, I speak with a lot of conviction because I have personally worked on very many development projects, and documentation has remained one of those gray areas that we are not very good at. We want to leave documentation to the people who love cameras. Luckily, I love cameras. Today, I'm feeling very awkward that I'm not taking photos. It feels just awkward. We want to leave them to people who are in the IT business. We want to leave them to the media people. And the impact of that is that we do a lot of work that is not documented. There's no evidence of the work we do. There's no evidence of the impact we create. There is no learning that we can be able to share out. And within this initiative, Amecea was tasked with the responsibility of shadowing KCCB so that together we can document and write a love letter to ourselves that we can read in the future. And that is precisely what we have this evening as we launch our products. We were guided by 4 key objectives. Objective number 1 was basically to look at the KCCB's approaches to the implementation of care reform work. Objective 2 was to look at the project results, very basic output level results. Successes, challenges, and opportunities for care reform within the church. Objective 3 was to look at the lessons that KCCB has been able to learn, put them together in a way that can communicate, can be used to influence, and finally, to develop visually appealing IEC materials from the process. And with support from the entire KCCB team, Mombasa team, and Kisumu team, we went from one place to the other. We've conducted focus group discussions. We've conducted key informant interviews. We've administered self-guided questionnaires. We've taken video, photos, videos, documentation of different people, different elements of this program, and we have compiled that into a number of products we are calling learning products. And that is what we want to launch this evening. And as I continue the last slide, because usually I'm not a man of very many words, I want to ask Pauline. Pauline, wherever you are, kindly, please be ready. with your team. And maybe it would be important for me to appreciate the support given to us by KCCB within the documentation process, all the people who responded to the many questions that we posed to you, all the many people we stressed to stand in front of these cameras and speak to them. We appreciate that sacrifice. We know it's not everybody who loves these gadgets. Actually, sometimes we had to craft almost word for word. Tell us your story, then we put it into a script and now repeat, so that we can have a coherent piece that speaks. We appreciate that sacrifice, that you took your time to speak to us on video, to respond to our questionnaires. Thank you so much. Sister Monica, all the time we spent in your home, thank you so much. It was amazing. Allow me to, in absentia, to appreciate two people that were very, very critical in this process. Father, allow me to do that. I want to appreciate Virginia and Abdul. They did a lot of work. They worked day and night to ensure that these products have taken shape and that they are ready for publication. Allow me to appreciate all the teams that gave input, reviewed this document, reviewed the videos, and gave feedback. Your feedback helped us to put together products that we can be able to release to all of us and say these are learning products from the KCCB's work. And finally, these products have taken the form of one care reform magazine. We have 4 sets of brochures, different brochures. A brochure is set on A4 but with fold. We have a set of 18 different posters, picking highlight messages from different personalities within the implementation of the project, and amplifying that, hoping that these very specific messages will create a lasting impression on the mind of the readers. And we have 5 different videos. The longest one is 14, the rest are very short, 3, 4, 5 minutes. And all these are products that we are hoping will go out there and create an impact and influence care reform within the entire region. I know we have a separate set of documents and learning products that KCCB has put together, including the CITAN. All that we'll be sharing with you after they have been launched. And therefore, it is my humble duty to ask Pauline and the team to help us with the launch. And to help Pauline and her team to do the launch, I want to invite our 2 bishops, our 2 Lord Bishops, if you could kindly join us here. Our 3 Lord Bishops, if you could join us here. I want to ask Sister Clara from Akweka to join us. Sister Clara, if you could join us here. I want to ask Father John from South Sudan. Where are you? And I want to ask Nelson. We invite him. You want? And finally, allow me to invite Merhavit Chala from Ethiopia. Pauline, what do you want us to do? I am told that the DJ had a song. This DJ.
Okay, kindly, the DJ, we are waiting for you. All of us, we will stand. We dance to the song as you welcome the troll. Okay? Okay, kindly let's stand. DJ, we are waiting for you. Okay, let's swing.
tushangilie, vigelegele. Siwasikii.
Msalabani ulitufia, ulitupenda, dhambi zetu kabeba. Baraka zako tuliziomba, kweli tumeona, hakika unabariki.
Thank you, DJ.
Hata vipaji wendo hutoa.
Okay, our bishops, you will remain. There's a surprise that we have for you for the good work you have done for us here. So just keep on waiting. Okay, the bishops are receiving. Thank you so much. You can applaud them. Thank you. So you can have a photo. Ni photo.
Tumeuona mkono wake Bwana. Mengi mazuri tumeyaona, Mungu umetenda. Ni Ulitamka vitu vikawa, neno tu latosha. Ukisema umetenda. Harisha Israeli, uliwavusha. Kawatoa utumwani. Watumishi wako umewapa yote waombayo, ikiwa umependezwa. Uamualo hakuna wa
We are requesting the lead persons for Mombasa and Kisumu and the Vicar General also to join in the photo. The Vicar General, Mrs. Masibo and Father David kindly. Father, the General Secretaries from the Amecea regions who are present also kindly join and have your photos taken with the bishops. Kindly grab a material.
Elizabeth, I want to nominate Konyango to join that team. Konyango, you have worked with us throughout this journey. You cannot be missing in that photo. How now? And then you ask us difficult questions. He's a guy. He's a
Msalabani ulitufia, ulitupenda, dhambi zetu kabeba. Baraka zako tuliziomba, kweli tumeona, hakika unabariki. Hata vipaji wendo hutoa, umetuwezesha, tunaimba na kusifu. Walio haki hutoacha, uliwaahidi, hata mwisho wa dahari.
Watu wako umewapa mamlaka kwa jina lako Yesu. Waponye. Hakuna ubaguzi, wote ni sawa kwako. Umetuita Yesu. Tuponye. Hakika wewe ni mwema.
Tumeuona Baba, mkono wako Bwana, kweli matendo yako Bwana ni makuu. Na umetutoa mbali kweli, ukatushika mkono Mungu, mahali uliona pekee. Chini hata chini yao watu unawainua Mungu, sifa na utukufu ni zako milele. Na tutakusifu, wasifu jina lako Baba, milele tutakusifu kweli. Daima wewe mwema, tutaishi kwako. Tumeuona Baba, mkono wako Bwana, kweli matendo yako Bwana ni makuu. Na umetutoa mbali kweli, ukatushika mkono Mungu, mahali uliona pekee. Chini hata chini yao watu unawainua Mungu, sifa na utukufu ni zako milele. Na tutakusifu, wasifu jina lako Baba, milele tutakusifu kweli. Daima wewe mwema, tutaishi.
As that continues, I want to ask Pauline and your team to share the rest of the packages. Pauline, you can give us the rest of the packages. As we continue to appreciate everybody who has made an input into that process, thank you so much for whatever input you made into that process. Kindly, we have sufficient of these materials, and apart from the printed versions that you will get, towards the end of this conference, you'll get a flash disk with every single piece that we have launched. The 18 posters, the 4 brochures, the Care Reform magazine. There's a smaller one called Written Protected. It's differently done by the Safeguarding Office at Amecea, but it's included within the package. You'll get all the videos that we have documented and put together. And additionally, that flash disk will have all the PowerPoint presentations that have been made in this particular conference. Thank you so much. We totally want to appreciate your patience throughout the day. It's been a long day. And as this team continues to share the package, I noticed that time is quite gone, and I know we have the celebration of the Holy Eucharist. I may need to be guided, because this is the same venue we are proposing to use for the celebration of the Holy Eucharist. I don't know.
Yeah, thanks, George, for covering up all this. We were thinking that would take about 15 to 20 minutes, take quick tea, while we reorganize ourselves, because the room that is reserved as a chapel for us is too small for all of us. So we wanted to reorganize where we are so that we celebrate Mass. So we could come at 5 o'clock. Yes, this is 4:30. We come at 5 o'clock for Mass. Thank you. Yeah, sure. So we have a prayer for tea. Yes. Okay. Please stand up. Let us celebrate you. You say something?
Okay, we can sing for her, wishing her this very blessed day of her birthday. What is the name? Christine. Okay, so we sing the song for Christine, then we have the grace before having the tea, and we come back at 5 for the Mass. Happy birthday to you. Happy birthday to you. Happy birthday, dear Christine. Happy birthday to you. How old are you now? Happy birthday, dear Christine. Happy birthday to you. Let us clap for her. Thank you. Happy birthday. She said she's just now 18. So we thank you for that. Let us have the grace before we have our tea. In the name of the Father, and of the Son, and of the Holy Spirit. Bless us, Lord, and these gifts you're about to receive from your goodness through Christ our Lord. In the name of the Father, the Son, and the Holy Spirit. Enjoy your tea. At 5, we are here for the Mass.